Everybody drinks. Everybody goes to pubs, and you don't tell them that, do you?
I do. I tell everybody.
I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain, I've got a whole brain, and it functions beautifully.
There, that's where your penis is. That's where you breathe from, and that's where Dr. Owen's showing you.
Exactly.
Oh, dear.
This is just this morning.
I've got liver cancer, not brain cancer, you know, but can still function, and I want to do that. Every day's precious.
Good morning, Pat. You need Iris speaking.
Yeah. I'm just trying to see who else does it.
And your name?
Who else does that thing for you? I'm trying to see which other doctor does it.
Hello. Sorry, I've kept you waiting too long.
It's all right.
How are things?
It's peculiar what happened. I was stung on my arm by a wasp that came in through the window.
OK. So when was this?
It was a couple of days ago. I couldn't move my arm. It swelled up, and then it felt achy all the time. It's still funny, my arm. I don't know whether it's because I'm a funny woman.
Do you want to show me where the wasp stung you? Do you want a hand? There we go. You got that one?
It sort of swelled up there, and it still prickles or something and aches.
Well, nothing's hot or red or angry.
It aches still.
Now, what's happening with the psoriasis? Have you been going to see the dermatology nurses?
I haven't, because I've been too busy.
Because they were supposed to see you, weren't they, in the daycare so that they could do your creams for you. It's still quite bad on your elbows, isn't it?
It will go. It doesn't hurt.
What's stopping you from going to see the nurses?
It's because I'm tired. I get tired. I can't sleep at night. I lie awake. We're moving.
Yeah.
And it's awful.
What's happening with your sister?
She's going to the country.
OK.
Retirement home.
And have you found anywhere that you're going to live?
No, I can't find anywhere.
As GPs, we're always taught that we should ask open questions and let patients tell their story, but it can be really difficult when patients bombard you with lots of different pieces of information at once. In a 10-minute consultation, that's really difficult.
So are you wanting to buy something then?
I want to buy a flat for the rest of my life. I'll be on my own with my cat, that's all. My sister doesn't want me anymore.
Oh. So did you ever think about going with her, or do you want to stay in Putney?
I want to be near Morley College, where I give concerts and I play Beethoven, Chopin, Brahms, Rachmaninoff. And I played all my life since I was 5 years old.
OK.
Music keeps you young. It kept me young. My father died of a heart attack in the hospital. I just visited him, and he said, good luck for your concert. And it was sad, really.
No, it is.
He said, be happy when you play. And he smiled. That's all.
I'm falling apart, basically.
Right. Oh dear, okay.
The last 4 or 5 days, I think I had an ear infection. My ear was agony.
Right.
And also, I would like you to look up to see what progress they're making towards this hernia.
Right.
And the large cyst I found, and I've had enough.
Yeah.
Do you mind if I have a good look at all the joints on each side?
No, have a look at everything.
Pain when I'm pushing?
Yeah.
Up and down, does that cause pain? Okay.
Yeah.
Bet they fractured the bone in my groin
When?
when they done the angiogram.
Okay. All right. Where do we start?
You have to go in soon.
What?
You know, the doctor's going to look at your ear.
Okay.
Are you going to be a good boy and let him look?
Okay.
Are you going to be a good boy?
Yeah.
Hello.
Hello.
Yeah.
How are you?
I'm well, thank you.
Hey, Mommy.
Hello, Matthew.
Hi.
When did I see you last? That was a while ago.
Hey.
It was
It is a
quite
while
like
ago.
10, more like 10.
Yeah, 12 now already. He has got another ear infection, and I only noticed it yesterday evening when we were in church that he had a lot of gunk coming out of his ear. He won't let me touch it.
Right.
He insists that it doesn't hurt, but he quite often does that. I've never been able to be sure whether he's just got a very high pain threshold or whether his communication's a bit off around it.
Cough, cold, snuffly nose.
He's been very tired, but no, not really. No. And
Fever?
it's quite difficult with Matthew because he doesn't tend to develop particularly high temperatures.
No.
And quite often, you know, it's only when you see the evidence of something. I imagine this has probably been quite uncomfortable for him for some time, but it's only seems to be when there's some visible sign.
Let's have a little look at your ear.
Yeah.
It's a bit of a mess, isn't it? You can't see it, though, can you?
He won't let me clean it or anything.
Can I just touch it with a stick?
Hi.
Yeah, not going to go inside, just on the outside. Get a little bit of that fluid. You look at Mummy for me.
Matthew, look at me.
That's good boy.
Look at me.
Ow, ow, ow.
Good boy, good boy, good boy, good boy, good boy, good boy. Ah, good boy.
Well done. Good boy, Matthew.
I like your jacket, Teresa.
Oh, do you? Well, you're not having it. I'm joking. I've seen you for a while.
No, we haven't. Have you been well this evening?
Yeah, but did you go to get fun
So
one
yesterday, I read this. And it really frightened me when I read it.
Oh, really? OK, well, we can talk about that. With this, what scared you about it?
It scared you about people dying, you know, not surviving the operation and that.
Yeah. OK. Did you understand what it's talking about, this
Yeah.
aortic aneurysm? Yeah. What did you understand by it?
Well, because my father had one.
Did he? You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot. Do you know if I've got one?
Hi. Oh my goodness. You have got a really big buggy, haven't you? Yeah.
Does the airway sound quite tight? Oh dear. Life is hard, isn't it?
All right, okay. All right, dude. Okay, cool. Oh.
Can I just pop this in your ear and take your temperature?
Can you hold your hand quickly?
Just, whoopsie.
Oh, dear.
It's all right.
Poor old you.
You got your hands full, haven't you?
Absolutely.
Do you want to just give him a cuddle and then I'll just have a look at it?
Come on, Bubba. Come on, sweetie.
Right, how can I help today?
So we just need to get a certificate of health from his modelling agency.
Let's have a look. She's going to be a superstar, is he? It's nice to see a well baby. I see lots of time seeing grizzly babies. Now, we'll have to ask at the desk whether or not sometimes these things don't technically come under NHS services and sometimes there's a fee.
Oh, yeah. No,
but I'll ask. Can I have a look at your tummy? Lovely, we'll just give you a little once over. Oh, let's have a little listen to your heart. Good boy. Look in your mouth. Good boy, thank you.
Very good.
Magic. Magic. So what I'll do is, I've got no reason to be concerned at all. I will sign this and I will just give it, put it in an envelope and ask you to speak to Nicola, who's currently on reception.
Okay.
Good luck with his stellar career.
Are you still smoking?
I still smoke consulate, cool as a mountain stream.
How many a day?
About 10.
Okay. Any thoughts about quitting?
What?
Do you want to stop?
What's what?
Do you want to stop smoking?
Not particularly at the moment, I'm worried.
I mean, it may not be the right time for you to stop smoking now, but I think it would be important to do it when things are more settled. What about alcohol? Because alcohol can increase your risk of osteoporosis.
I'm trying to cut down.
That would be really important. If you try and cut it down so that you're having less than 14
My sister, we
units.
both try and have half a bottle each.
Over what period of time?
On a night.
Half a bottle a night?
We have little small glasses. We fill, and she goes back again and fills.
But if you're having half a bottle every night, that's much more than...
No, she has her bottle. I have mine. They are small ones.
OK, but even if you're having... What, do you have the whole bottle?
No, we don't drink... No, we have she has a small glass and she fills it about that full.
Right.
Full.
What we recommend is that you don't have more than a bottle, if you're drinking wine, a bottle and a half a week.
Oh, everybody drinks. Everybody goes to pubs and you don't tell them that, do you?
I do. I tell everybody that they need to not drink more than the recommended amount. The other thing that you need to do is make sure that you're getting enough vitamin D and calcium in your diet.
Oh, I expect you're hungry, aren't you? Have you had your lunch?
I haven't, no. I've been busy.
Oh. Well, you must come to my flat when I buy a modern flat in Putney and have a meal. I'll cook for you.
Thank you.
Spicy cheese grilled.
OK.
And you put tomato puree, a bit of that, and you make an ordinary tasty thing, and you put few herbs in it, and then you grill it, the top of it.
Sounds good.
And put a gherkin on top.
OK. Right. The things that I'm going to do is, why don't we see each other in a few weeks, OK? And then you go and see the dermatologist tomorrow about the skin, OK?
Yeah. I better go.
All right.
Thank you very much.
And that's your time of the appointment, remember? So you take that. All right, so you go and see them tomorrow.
Thank you.
See you later.
What do doctors do when they, finish at 12 but then start again at 5?
They either go home if they live close, or they do paperwork, like catch-up work.
This is Dr. Hassas from Putney Mead Surgery. Hi there, I had a message to give you a call, sir.
The work is endless. I was expecting to see you this morning, I think, to check your blood pressure. When we've finished seeing our patients, we've then got to type our own referrals, read all the letters coming back from the hospital. We need to check blood results, review people's repeat medications. The list is just goes on and on and on, and you never feel like you get to the end of your work.
Well, when did all the trouble start?
I tried to ring you yesterday, but you were unwell.
Just give me an idea how long this has been going on for.
Right.
Give me a rough idea.
OK, take care. Bye.
Yes.
So they haven't written to you because you've got one. They've written to you and thousands of other men of your age to see if you've got one. Did you understand what it's talking about, this aortic aneurysm?
No.
No. What we'll do, why don't we draw a picture? So, my drawing's very bad, all right? And that's your body. OK. It's not a very good drawing. But your heart is here.
I think that's your legs, Richard.
Brilliant. Well done. Yeah.
There, that's where your penis is. That's where you breathe from, and that's where Dr. Owen's showing you.
Exactly. Exactly. So, this bit here is called the aorta. And normally it's nice and straight like that, like a railway track. Sometimes it can swell up a bit like an orange, and it bulges out. And this is what is called an aortic aneurysm. What they've done is they've written to you to get you to have a scan that just looks at your aorta in your tummy. So it's not saying that you've got an aneurysm. It's not saying that you need an operation for it. You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot on the heart.
Okay.
Yeah.
He had an operation on an aneurysm, did he? Did he? Okay. But just because he...
But he had a blood clot there.
Did he? Yeah.
So...
Yeah. After operation, sometimes people can get blood clots, unfortunately. But just because he had it, it doesn't mean you've got it. Richland trees, they have different needs from a lot of our population. From my point of view, I see my role as helping them negotiate the health service in order to use it effectively. Richard, they're not going to do any operations on you. What they're talking about doing is putting some jelly on and having a look. You know when pregnant women have their babies looked at?
I'll be with you.
Oh, is it the same thing?
It is, yeah.
Oh, right.
It's what's called an ultrasound scan. Okay.
It's nothing to do with your stomach, is it?
No, it's nothing to do with your tummy being big. Okay. Sometimes, if you're very thin, we can feel them, but I think you're a bit too big for us to feel it. I can try and feel it if you like, but it's quite hard to. If you've got a bit of fat on your tummy, we often can't feel it.
Doctor, don't say that. He's trying to lose a lot of weight, is he not, son?
I'm not overweight.
Yeah.
No, he says, look, he's laughing.
I'm not laughing. But you know your tummy's bigger than mine, isn't it?
Yeah, but it's not that...
He does go to the gym a lot.
That's really good. And going to the gym helps stop things like this. Yeah, that's really helpful.
Can we give you some medicine?
Yeah.
You sure?
Yeah.
Okay, good. So, eardrops, have you had much success with over the years?
No.
No, okay.
Getting anywhere near his ears is...
So I think, the swab should just give us the bug and hopefully which antibiotics it might be sensitive to.
Mummy.
Aren't you?
Mummy.
You let the doctor look, didn't
Mummy.
you? Yes, Matthew.
Down.
Down?
No, down.
Dance?
Yeah.
Are you a good dancer?
He's addicted to Strictly Come Dancing at the moment.
Oh, I'm addicted to Strictly Come Dancing. Who's your favourite?
Football.
Football?
Football?
Yeah.
So who's your team, Matthew?
Fulham.
Fulham?
Yeah.
Excellent.
Fulham.
Fireworks. Kitty and fireworks.
Yeah.
Your favourites?
Yeah.
Fireworks night's coming up.
Yeah.
We went to see some fireworks last night, didn't we, Matthew?
We're going to watch some fireworks tonight.
No, I'm going to watch the FA Cup.
Oh, sorry. Got the wrong pastime.
Well, yeah, fireworks are for kids, aren't they?
Yeah.
Did you do anything for fireworks last night?
No, I was too tired. And it was too cold.
Yeah, that's true, actually.
I haven't been to a firework display. You wouldn't believe what my brother's dog did. They were out. This is last year. A hole through the door. I'm not joking. It's terrible.
When did you get her?
She's 3 months now.
Really? And she's a hearing dog, is she?
Yeah.
No?
Yeah.
No.
She's an everything dog.
An everything dog?
Diabetic dog.
Okay.
So she knows just that.
Really?
The clever.
Yeah.
Very clever.
Brilliant.
Almost as clever as you. Have you got a dog?
No.
I
don't want one. Okay. What pain? Really? Tell me about it.
My heart. Because I'm walking her all the time. It makes me twat. And I'm walking with her.
Are you getting it every time you walk her? Yeah. Will you take off your shoes and I'll have a look at your feet and your legs? Okay. Let's have a look. And is there any pain when I'm feeling your legs? Does that hurt?
That.
Yeah. Okay. I can feel some veins there, but what we always wonder about is that we know your diabetes isn't very well controlled.
I'm on the wrong insulin. This is why I'm waiting for the referral to go and see the
And I'll ask about that. That's fine.
I sat in an empty waiting room for over an hour. Right? I couldn't get out of the chair. I can't sit down for very long. Right? I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain, I've got a whole brain, and it functions beautifully. And when I said to him, why am I an hour late? And I did do that. Why am I an hour late? And we take a longer time because we care. I don't give a toss who you care about. Do you know what I mean?
Yeah. It can't be that people are upset by every interaction you have with our surgery. That's not fair.
Could you have a look at a mole I've got that's behaving a bit funny?
I've got burns.
Okay.
And then I have a mole here. It's just a bit scary.
Right, how long's that been there?
Over a year.
You can just feel it, can't you?
Yeah.
So it's quite rough in texture, isn't it?
But anyway, you might be able to see it.
Oh, this.
Just looking at it, it doesn't look like anything sort of overly sinister.
I can reassure you that this is not a sinister type of mole.
This is a freckle. Very unlikely ever to cause you a problem.
The things that we do look for in moles, we have an ABCD rule. We look for any asymmetry of the mole, so anything that looks a little bit irregular, any change in the border of the mole. C would be for colour change, so if you're getting darker patches within the mole, then that's something to worry about. D is for diameter, anything that's more than about 6 millimetres. E for anything that's evolving, so anything that's itching, bleeding, anything that feels like it's changing, always come and get that checked out.
Yeah.
OK. Have a good rest of the day.
Right, you too.
Take care.
Thank you.
Bye.
What were you thinking we might do about this pain?
Tramadol, actually.
Really? Just painkillers?
Yeah.
We can certainly go with painkillers, but we need to be cautious with you because you are at risk of getting problems with the blood supply to your legs. If you get any chest pain when you're walking, or if you're noticing that when you walk a certain distance you get pain in your legs that settles down when you're resting and then comes back when you start walking again, it's very important that we do get a vascular surgeon to see you, to check on the blood supply to that area.
Does it look like it's got a reduced blood supply?
No, not significantly, but actually...
Don't tell me significantly. Does it yes or no? If it was your foot, would you take it somewhere?
Part of my job is to manage risks. I know that you're at a high risk of having problems with your blood supply because of your diabetes, okay? So it's nice to want definite answers from doctors sometimes, but we can't always get them. It's not, is it?
No,
exactly.
it's just based on the opinion of the individual.
When you came last time...
Oh, God, no.
Why do you say that?
I'm very flexible. I come here. All I come here for is to get my medicine.
Yeah.
I
There's flexibility on both sides.
Exactly.
All right? I'm very flexible with you,
Yeah,
okay?
you are.
What I would say is Doesn't matter what profession you work in. If someone shouts at you when you're trying to do a good job,
No,
it's
she was
terribly
talking-
upsetting.
Right. The reason why I knew that she was talking is that all your muscles here move when you speak, even if you don't move your lips.
I'm
am
sorry,
deaf.
you've obviously had
I
it.
am not stupid. I have an IQ of 156. You know, I don't want to be, and how are you today? I could just feel the hand patting my head. No, you don't talk to people.
All right, I'm going to leave
And
that.
this, you know what I feel about that.
Yeah. Do you know, when I see you, do you know probably on average how much time I spend with you?
I know. I know.
Yeah.
I don't understand and yet I'm grateful for it.
These are just normal people. We're all normal people, but it just worries me the regularity of it. Abuse within the NHS is taken very seriously in every practice, but the aim isn't just to tell people off, it's to try and work out why they felt the need to react in that way. And usually you can work with people and find a way forward with them.
It was because I was so stressed. I will apologise to him.
Did you?
No, I will.
Okay.
But I will apologise. And
Let's,
as I
we'll
say,
finish now, all right. I'll get that one. I'll find out what's happening about that diabetes appointment. Come back and see me in a month.
Month.
Yeah. And we'll see how your legs are doing. Right.
I am sorry.
Do doctors get ill? Like,
yeah.
Like, how? They're doctors. Can they just... This is so weird being a doctor going to the doctor. I think I've had this conversation with you before.
How was your holiday?
Oh, it was lovely, thank you. Very nice. We went to Snowdonia and did some walking. Came back and got a bit ill again, unfortunately.
A doctor got ill?
Oh, yes, quite a bit.
Oh, that's no good. Are you better now?
A little bit, a little bit. I'm usually very well. Last time I was ill was the swine flu, so...
Don't go on holidays. It sounds fatal.
Hi, come on in. Right, so you're here for a refit of your implant.
Yeah.
Perfect. So, is this the first one that you've had in? Yeah, and you've been really happy with it as a method?
Perfect. Absolutely amazing. Couldn't have asked for better. Yeah,
Brilliant.
really good.
And have you had any side effects from it?
Not at all. The first couple of months, I think I was told it has to regulate out.
And then you've just had no periods
Nothing.
for the last 2 and 40
it's been
years?
perfect. And I suffered
Brilliant.
really badly with cramps and everything beforehand, and it's just completely eradicated the whole thing. I haven't had anything, so it's been great.
Fine. So it won't be painful at all. Taking it out can be a little bit fiddly.
Okay.
Because after 3 years, the body can put some fibrous tissue around it as a little sheath.
Yeah.
Are you happy to get on with it?
Absolutely.
Is it left or right arm?
I'm in here.
You've got it in your right arm. Okay. Hopefully that will be straightforward to get out. So what we need to do, I pop you on here. So I'm just going to get everything ready on the trolley. The first thing I'm going to do is just do the local anaesthetic injection. Well done. And once this starts working, you won't feel anything else, I promise you. You will be able to feel me touching you,
but not pain.
But you won't be able to feel pain. Okay. So, can you feel anything? Wow. Just releasing the little capsule that I talked about that can form around it.
Okay.
It's out.
Really?
That's pretty quick.
Oh my goodness.
And I can put the next one in.
Okay.
And you will be done. Just put it on a little pathway just along the side of the original one.
Okay.
Done. Wow. Finished. That was really straightforward. You did really well. And this will last you another 3 years until you come and have your next one in.
Come in. Hi there. Mr. Gomez. Hello, sir. Come on in.
You don't know about me, do you?
No, it's the first time we've met, so no, I
Okay,
don't.
I've been a patient here for a long time. And I've discovered that I had cancer, liver cancer, a couple of months ago, but it's very bad. It's beyond surgery, so I'm going in towards, I think, the end of this month for the chemo. It's going to be a chemo Christmas.
Right.
I live alone, and I'm really struggling with the pain of this. It's extremely painful. It's those I'm taking. They're supposed to be every 4 hours, but I can take them every 1 hour, up to 1 hour if I want them. So I'm taking them every 1 to 2 hours.
Okay.
Sometimes I take them 3 and on the trot, 1 hour on the trot.
3
and then something, but I try not to, because I don't want to build up too much tolerance, because when I get to the end of all this, I'm going to, I'm going to end up taking buckets of it, and I don't want to do that. I've been in so much pain for the last couple of months.
And where is your pain at the moment?
Oh, it's all in this region
on the
here.
side of the liver. Okay.
Yeah, it's all in that region just there.
Okay.
I can't do anything like cooking, getting up, and the other thing is, look, it's my legs. This is all like water. She said it's water.
It does look like water, tight, isn't it?
My feet are like loaves of bread. I can barely get my shoes on. Yeah.
And sometimes when you have problems with your liver, the amount of protein in the blood drops, and then the fluid is just leaking out into the cells, and that's where you get the swelling.
Yeah.
So the idea, I think, probably behind the chemotherapy and all of those things is to reverse some of those side effects of the liver problems.
I hope so. It's, I don't know. I don't know. See, I'm on my own. I'm taking care of myself.
Right.
So it's very difficult,
Yeah. Have you got any other support around?
At the moment, that kind of support, I don't want that support,
What kind of support?
Like coming around and cooking for me, cleaning for me, doing it. I want to do that myself until I can't do it again. I've got liver cancer, not brain cancer. I can still function, and I want to do that. Every day's precious. I don't want to give it up. I don't want to give up responsibility. I want to go down to the shop and get a loaf of bread.
Yeah.
I want to touch it before I buy it. Is it fresh? You know what I mean? And I want to do these things still, and I don't want to take that away from me yet.
No.
That's all I've got really. The little things in life, which are the valuable things in life.
Precious.
Just take the dog for a walk on Wimbledon Common with the boy. There's lovely little precious things. But you can't do it if you're in agony.
How long were you in hospital for?
2 weeks.
2 weeks,
Yeah. They took me in. They said, your bowel's ruptured. Basically, I've been walking around with a ruptured bowel for God knows how long.
And how are you managing now that you are home?
I'm okay. My belly's a bit of a mess.
Okay.
And I've got a bit of a hole here.
Okay.
I'm just worried about, because I wasn't told anything about Crohn's disease. I don't know what to eat, what not to eat.
When you've had part of your bowel removed, your bowel absorbs nutrients, and so depending on what part of your bowel has gone, you need to make sure that you're getting all the nutrition.
Hungry all the time. Is that normal?
It can be. It's a big thing for your body to go through, and your body will be working harder, helping to heal everything up, and your calorie demands will be higher. And how are you doing? A lot of people struggle at the beginning with just how it all feels and looks like. How are you?
I haven't got a colostomy.
Have you not?
No.
Oh, I thought you had a colostomy.
No, I just missed it.
Oh, I didn't know that.
Just missed it.
Wow, so they resected your bowel and then...
I'm really lucky, because I think I'd just die if I had to have one.
I thought you had a colostomy.
No,
okay.
That's why I'm worried about what I eat, because that surgery could happen again, and I don't want one.
No. You're doing an amazing job.
Thank you.
So far.
I don't have very long, and I don't know. I'm going through all kinds of negativities,
About the chemotherapy.
Yeah, once I'm in there, I'm wired up. That's it. They got me.
Part of my job as a GP, we deal with people who have terminal diagnoses, and it's always upsetting to be with someone who is going through those stages of life. You have to try and keep that emotion to yourself, and make this the interaction about them. What are you worried about? What worries you? The agony of it. I know the pain there.
I know what's coming. Yeah, I already know what's coming. I can feel it. but with the chemo, I can possibly push me up to a year, maybe beyond.
I'm always impressed by how people find resources within them to face the final days or weeks bravely.
I've got a severely disabled lad. He's blind. You know, I've been his sole carer for the last 16 years.
Right.
It's my son, yeah.
Yeah.
And I need to prepare him because he's acquired brain damage. You know, he needs to be prepared for this one. You know, we protected him when his mum had cancer, and she died, and he was in a mess. You know, so now he's going to have no one there.
Does he have any carers or any?
Oh yeah.
He's got people around him.
Yeah,
okay.
he's with guide dogs. You know, he's got a guide. So, but
So there's all of that worrying you.
Yeah.
As well,
His welfare. Yeah, his mental state. That's what worries me. Yeah.
And what kind of support, ideally, do you think he would benefit from?
Well, that's what I mean. I want about a year to sort of watch it. You know, to sort of, I need a year to get him prepared and to be prepared to be on his own now.
Yeah.
You know, there's things I need to settle and take care of. Yeah.
If you have a think, and if there's anything else you think you need help with, or we might be able to help with, will you just give us a shout, and we can work it out?
Yeah.
I'll give you the amounts, more of these, both.
Oh, the same again. Yeah.
Yeah. I'll give you a bigger volume.
Yeah.
So that he doesn't run out.
Because I need to get this under control.
Yeah.
The management, the pain management. Yeah.
The pain we will get under control. The pain will get sorted.
Okay,
all right.
Thank you very much.
Nice to see you. Give me a shout if there's anything else.
Thank you very
all right.
much. Thank you.
Take care now. Cheers. Bye bye.
Come in. Hello. How are you?
Okay.
You're wearing glasses. Oh dear.
This is just this morning. Sunday was kind of okay. It was a bit swelling underneath, and then this morning, swelling even more than this.
So it's got better throughout the day?
Yeah, a little bit. I did take an antihistamine in the morning.
And do you think the antihistamines made much of a difference?
Not really.
And is it very itchy?
It's not at the moment.
It's just very puffy and swollen, isn't it?
Yeah.
And you're not wearing any eye makeup or anything like that?
No.
Poor you.
I'm also concerned that, the flaky skin bit kind of seems a bit yellowy.
One of our doctors does have a special interest in skin. Let me see if my colleague's available just to get a second opinion.
Is it just on your face?
The swelling is, yeah.
If we give you 2, so we give you the 1% hydrocortisone.
Yeah.
Use the stronger one for a couple of days.
Okay.
Just to get it down and get some of the swelling down.
Yeah.
You're going to have to moisturise well because as soon as that swelling has gone down, you're going to go wrinkly.
Yeah, yeah.
Which is horrid. What job do you do?
I'm a teacher. I've got parents' evening tomorrow.
Oh dear.
Do you feel sort of anxious or worried?
I'm not sleeping very well at the moment. Which is very unusual for me. I wake up all the time.
I'm still not sleeping properly. I haven't gone back to work yet because I've got another certificate from another doctor.
Okay.
And I prefer to have another couple of weeks off so I can get my head together and think what I've got to do.
And the problem with sleeping, I don't get sleep at all. Maybe because of the stress, the workload, what I do, could be the reason. And tiredness is for the last 2-3 months. I'm really, really tired.
I mean, this kind of gives a good description in some ways of what you've been experiencing. You're finding it hard to kind of see the light side of life and not enjoying things as much as you used to.
That's been quite a stressful few months.
It has been a stressful few months. I can't get through the day. I'm kind of worried.
But small steps, because you've come a long way.
Hiya. Come through, Tony. How are you?
Well, thank you.
You look great. Like the trousers.
Thank you.
They're fab.
Back at uni, so...
Oh, right, OK. What course are you doing again?
English literature.
Right, yeah. I got a letter from Dr.
Ducci, yeah.
Yes. And you're on a waiting list for psychotherapy?
Yes, I'm currently seeing Dr. Healy at the Wandsworth Complex Needs every 3 or 4 weeks.
Right.
When I first found out I was diabetic, it definitely really threw my mental health, and I think I definitely wasn't coping for a period of 6 months, and I think I've got over that phase of, I think it's called burnout, when you stop testing and you stop really trying to look after it, and I think I'm testing 3-4 times a day now. I'm really trying to get a control of my blood sugar.
Yeah. Whenever a young person, particularly that has had a mental health problem, gets a diagnosis of type 1 diabetes, it's a very difficult combination. I haven't seen you when you're unwell with your mental health. And Dr. Ducci's indicated that you've had some really difficult times in the past.
I lost my mum when I was young, and I was initially born in South Africa, and now I'm at 15 social services intervened, so I've pretty much looked after myself since I was 15. So that's probably a lot of the issues. It was very early independence.
And were you very vulnerable at that time?
I think so. I think asking any 15, 16-year-old to look after themselves is a big thing, but I wouldn't have changed it because I'm here where I am now. And
brilliant.
Yeah.
I know from my experience of being a patient how much courage it takes to come and sit in the chair of a patient. It would have been about 15 years ago. I had an eating disorder throughout medical school, and it happened at a time when I was a single-handed GP running a practice on my own. I had 3 children under 5, and I was working very long hours with very little sleep. It was very difficult to sit in that doctor's chair day after day, year after year, telling people to look after themselves when I was crying out to be looked after myself. I think you're very self-aware, and you're obviously resourceful, built self-reliance, but just let people in as well. I went downhill pretty quickly until one day I could only get halfway to work and decided I couldn't do it anymore. And that's when we called our own GP and asked for help.
Is that everything?
Yeah, I think it is with me.
Yeah. Have a good day.
Thank you very much. Thank you. Bye, Tony. I've come through. I'm able to truly accept that illness is not your fault. And doctors are patients too sometimes.
Sometimes if I would feel a bit depressed, I would start punching up a wall. Instead of cutting my wrists, I would do that rather, you know.
I got to the stage in life when doctors are looking young.
Okay, all right.
Oh dear, sadness.
I was obviously clinically depressed, like, you know, this isn't just low times. We're talking, yeah, pretty bad.
And when you faint, do you actually sort of lose consciousness, or do you just go to the floor?
When I fainted, I knew what was going on because when my friend said you're going yellow, so I got to the floor and then I fainted. Good morning, Putney Mead. Naomi speaking.
Yeah, just to let you know, it's a teaching appointment, so there's going to be a student in the room.
At the moment, there's nothing I can book in advance.
So what's your date of birth? And what's the name?
Hans, morning. Right, so what's happened in the last 10 days?
Well, I can tell you what's happened this morning. Very depressing for me. I ran upstairs to the toilet, but I had a...
An accident?
Yeah, an accident.
Loose or...?
Yes, it's always very soft. I don't have any constipation. What I have noticed on the pan is the stuff was going not down, but up and sideways.
Right.
And it was on my cheeks too.
A bit of splatter.
Yeah, I've never had that before. March this year, I had an accident in the kitchen where, you know, luckily it was on the lino, but, you know, it's pretty disgusting, isn't it?
Right, okay, so you had all those blood tests done and kidney function's normal, thyroid's normal, liver is completely normal, kidneys again are normal. Okay, we're going to have to feel the back passage, I'm afraid, Hans.
I feel sorry for you. Would you want me to take trousers and pants?
Oh, just pull them down. You don't need to take them off.
Yeah. I do get some on the side of the pants, some hard, dark, blacky brown spots, and they're very hard to shift. I have to get a scouring pad. I can't flush them away.
Right.
They're very sticky.
Roll onto your left side.
Left side, sorry.
That's okay.
There we are.
You get a bit of itching down here, don't you? The skin's at the back is just a little bit abraded.
Well, I suppose that's because I've been rubbing it, especially this morning.
Okay, little pressure, shouldn't hurt.
Yeah. Oh.
And certainly no blood there.
Good.
And no lumps.
No lumps. So it's not piles or hemorrhoids?
I certainly couldn't see any, and...
And there's no mess in the passage at all?
No.
Oh. It's funny, since you've done your examination, I feel I got an urge to go to the toilet again.
It's not uncommon. You may have to go, yeah. But it's not been diarrheal.
It comes out stringy, like about the size of my index fingers, curling round, you know. And then I've had soreness.
Is it itchy at the moment?
No.
No. I don't have any strong alarm bells about any of this at the moment. I think we're going to wait and see for 3 months, Hans.
Right, thank you.
I haven't got any magic medicine at the moment.
If there are any more problems, I'll come back. Thank you, Doctor.
Okay.
I woke up like this morning. Yeah, I have very bad teeth. I'm ashamed to say. There's stubs and everything. And I don't know whether that's what's done this to me.
So it's all swollen. Is it painful?
It's not that it's painful, it's just more awkward.
Okay.
You know, to try and open my mouth, and I just... I'm so upset. Is there any way I could go to a hospital and get these teeth out?
You can, but that your dentist will organise that.
I haven't actually registered with a dentist here.
You'll need to see you need to register with a dentist.
You see, I'm terrified of needles.
Don't worry, that's all right. We're here to try and help. It may be that we can give you some antibiotics. That's what we could do, really, to let it settle down while you're waiting to register.
How long will that take?
It probably is just a dental infection, and the antibiotics will get on top of it quite quickly. Let's have a little look at this mouth, and I'll have a look in your ears. You open up for me. Yeah, it looks like there's something quite nasty going on at the top there.
Sorry.
All right. When I did look inside this lady's mouth, it wasn't a particularly pretty sight. It was pretty appalling. Some people just have a sort of almost a phobia. It's difficult sometimes getting people to access the treatment they need. You just have to take them through it, really. What we need to do is get you started on some good broad-spectrum antibiotics to get on top of that, but that's all that we can do, really.
Yeah, see, I'm so terrified of needles, that's why I don't go to a dentist. I know it's stupid.
If they want to do anything, we'd be happy to prescribe a little bit of sedation for you to have some procedures done.
I need to be knocked out because, I mean, they're they're in my guns, you know.
Yeah. Okay, these, you're not allergic to penicillin?
Not that I know of now.
So this is a week's worth, 3 times a day. That should get on top of it quite quickly.
Okay.
All right.
Listen, thank you
No
very
problem.
much.
It'll settle down with those antibiotics. It really should, but obviously it needs more than just antibiotics. All right. Okay. All right.
Thank you very
No
much.
problem. Bye now.
Bye.
You not on any medication? Or why have you got to have a medication review then?
Hi, oh gosh, hold on 1 minute.
Do you smoke?
I smoke a tiny bit.
And how much are you smoking at the moment? I'm a detective.
Yeah.
One day when I sort of put my hand out, I had a cigar there.
Yeah.
And I thought, I don't remember lighting that.
Is it all right to ask you some questions in front of your mum? Is that all right?
Probably.
Do you smoke?
No.
No. Okay. All right.
I'm Dr. Mackenzie. We spoke on the phone last week.
Yes, we did.
Same problem?
I've restarted my antidepressants after a 6, 7, 8 odd week break.
What is it you take?
This is it here, if that means anything to you.
Yeah, and what dose do you take? One of these a
No,
day?
I'm taking 2 of those a day.
Right, okay. Does it work?
There's highs and lows. To cut a long story short, now I'm going to start. So, I need to get onto something that's going to give me my life back, because I'm not, it's not happening. I'm not enjoying, I'm not living, I'm not anything.
Good morning, Punny Mead. Rachel speaking.
We don't have anything for tonight, unfortunately. We've only got mid-morning by the look of it.
No, I don't have any today, sorry.
OK, just bear with me, I'll have a look at it. Unfortunately, no, not at the moment, I'm afraid.
So that's with Dr. Deman, 5 o'clock.
Come in. Hi there, hi. Come and have a seat. So Ellie, is that right?
Yeah. Ellie was going through really dizzy spells and just feeling absolutely ghastly. And we ended up at the Cromwell because she sort of did this dramatic collapse in the waiting room.
Right.
They ended up putting her in an MRI. But we ended up at an ENT specialist, and he thought it was just really bad labyrinthitis.
Okay.
She couldn't move. And ever since then, we've had continuing episodes. Normally it's just sort of a day here and there, but this last week has been really awful. She feels so dreadful. She's just miserable.
Yeah. So do you want to just explain to me what it feels like when you...
It feels really dizzy, and sometimes I feel sick and nauseous.
Have you been sick with it?
Yes. No, I haven't been sick. I just feel nauseous and really yuck.
And have you had any fever or sort of coldy type symptoms?
I get the often cough, but I don't think it's like a fever.
And is it generally, does movement generally make it worse? Yeah, so that's why lying down helps you to...
She just wants to lie, and then we can't get her up.
Yeah, but then when I lie down, I can't really get up because I feel so dizzy. I can't move.
So I'm just going to take your temperature. And any headaches at all?
Yeah, I've had a couple of headaches, like really bad ones.
Do you want to describe the headache to me?
Sometimes it feels like somebody's like ringing, the church bells. It feels like I'm like right against one. And sometimes it feels like there's somebody hitting me, and it really hurts.
And when you faint, do you actually sort of lose consciousness, or do you just go to the floor?
When I fainted, I knew what was going on because when my friend said you're going yellow, so I got to the floor and then I fainted.
I'm just going to ask you to follow my finger with your eyes, but keep your head still for me, okay? So, and just tell me if you see double, okay?
that's fine. From what you're describing, it sounds absolutely like a sort of inner ear sort of disturbance. What we could try would be some regular Stemetil.
Does Stemetil help the dizziness or just the nausea?
Both.
Okay, all right.
Yeah.
Okay.
Then if things aren't settling or worsening, then I think it would be reasonable to seek the ENT's opinion.
Sure. Can I get a referral letter from Mrs.
That's fine.
Benjamin?
Yeah,
Is that all right?
that's fine, and I'll do that, and I'll leave that at the reception desk.
All right. Sorry.
Okay.
Thanks. Thank you. Have a good day.
Okay, and you. Bye, Jenny. All right.
When did it all start not to be right?
Many years ago.
Mm.
Many years ago.
5, 10, 15, 20?
Triggered with children.
Yeah.
Triggered with the birth of the children.
So there was some postnatal depression?
Postnatal, definitely. I was obviously prone to it. It's depression in my family, but clinically depressed. Like, you know, this isn't just low times. We're talking, yeah, pretty bad. Yeah.
Dramatic things?
I think so.
Suicide attempts?
Not attempts, thoughts.
No. Thoughts, okay, fine.
Which is a step up.
So psychiatrists you've seen?
Yeah. I've just got this deep-seated depression. I just don't know how to get out of it. I really don't.
Mm-hmm.
And, you know, the kids are suffering with my moods, my this, my anger, my aggression, my everything. So it's not a very nice spot to be in.
Okay, so I think
Very difficult.
the situation at the moment is certainly not to rock the boat. I think we certainly don't want you to run out of your medicines. You've had 6 weeks off.
Yeah.
And that doesn't seem to have helped. You know, so we'll give you a prescription for another month of that, and then we need to talk again. So there's enough there for 4 weeks, 2 a day, so that's the 40 milligram. So if we can meet in about 4 weeks' time. The children, boys or girls?
One of each.
Right. I want to see you before those tablets run out, so about 3 to 4 weeks up the road.
Yep.
And you can come back sooner if things were different or worse.
Okay.
Okay. Bye for now.
Bye. It's NHS, they're up to their eyeballs with appointments for sick people.
I'm going to be doing some very basic stuff: height, weight, blood pressure. You're a gentleman who has quite a few health conditions.
Yeah.
Yeah.
But I feel perfectly fine.
Which is brilliant, and
Thank you
we want to keep you that way.
Yeah.
So to give you a little bit extra time with a doctor to make sure that I'm just looking at your face and you're not saying ugh, but it's to make sure.
No, well, I've got a problem straight away with that.
What's that?
This. In September, I asked for a book.
Right.
She went to her cupboard. No, I haven't got one. So she wanted to give me the other book.
Right.
Which I can't get on with.
Right.
Now, that lady could not walk next door to get one. So this is my problem when you're talking like this.
Right.
You imagine if I've been seriously ill or someone had been seriously ill and she couldn't be bothered to go next door. Yeah. She shouldn't be in the job, personally.
Right.
Nothing against yourself, but when you're going on about all this, and I've had an experience of that,
yeah.
I don't think it's very funny, like, personally.
No.
Sometimes you feel like you sort of, well, does anyone really care anymore?
Right.
Hi, Mr. Walker. Come in.
You are a very lucky man.
Why is that?
Just about ready to get away.
Were you?
I've been waiting here over an hour.
Yeah, I'm really sorry. I've just been...
It's no good, it's not good. Very annoyed. Carry on.
This has been going on since last December, and I've had enough.
But how long is it going to be? You know, I'm going to be dead by the time I see that.
Yeah, okay.
The service has gone downhill, personally. That's how I felt.
Yep. Yeah.
And the only other thing I've got to think of, I'm not happy with the book.
Come in. Hi there. Hi. Lost your voice. Have a seat.
I'm not Rose, by the way, I don't think we said.
No, I don't think we have.
No.
So I don't know whether you've had a quick look, but it's an ongoing condition.
Okay.
So I've had 7 operations
Right.
over the last 7-8 years.
Mhm.
I've got another one due in 4 weeks. But it never usually gets as bad as this before an operation.
Don't you just explain to me the history?
Yeah, so it's the HPV virus on the vocal cords. The first time it happened, they cut them away, analysed them, it's all fine. And it was quite a while before they came back. And then this year, I've had 3 operations.
Right.
So it's quite aggressive at the moment.
Yeah. And other than the sort of loss of voice, do you get other symptoms with it? Is it uncomfortable or?
It is at the moment, because I'm having to push words out, I think.
Yeah, so it's
Because when I try to talk, there's nothing coming out at all. And it's
quite exhausting.
It is.
Yeah.
And I'm having a few issues with work because I work for a university, student inquiries, and I can't answer the inquiries.
You can't answer the inquiries at the moment.
No, it's just getting quite impossible, really, to carry out my job. Really, I'm just asking whether it would be possible to be signed off until the operation.
We'll just have a look and see. Don't open your mouth up nice and wide for me. And say, for me. It's not in the area that you can see, it's further down onto your vocal cords, so you can't actually see anything there. Okay, no fever or cold or cough or anything like that? No. Okay. And it doesn't seem that there's much choice really if they can't bring the operation forward and work can't find anything else for you to do. It doesn't seem that it's fair for you to continue working. So I send you off to the Monday following the operation on the Wednesday. Hope it goes all right.
Thanks. You'll be used to it by now.
How long have you been on the HRT for now?
2 years.
Okay.
Yeah, 2 years.
And what symptoms did you have before you went on it? What was the reason?
Well, I went to my gynae, who I
Right.
see every year. He's known me since he produced my last child, who's 23 years ago.
Okay, all right.
And his expression was that I'd hit the buffers in my life.
Okay.
And he said, I've got some magic potion for you.
Right, okay.
And this was it, and then indeed it has been magic.
Okay.
You know, he put me on this and I haven't looked back.
Are you having any periods at all?
No.
No. And
Thank God. Those days are over.
Oh, right. And what did he explain in terms of the risks and benefits of...
Lots. He explained everything. I do have mammograms.
And they've been normal?
They've been normal.
Can I do your blood pressure? May I do that?
Oh, crikey. Yes, I'm just about to play tennis and
Right.
all sorts of things. And
When you're on HRT, we need to keep a close eye on your blood pressure as well.
do you? Oh, okay. I didn't realise.
So, nice slow breaths and then we'll... Okay. It's not very high, but it's certainly not kind of in the low in your boots.
All right, okay.
But I think given that you're on HRT
Yes,
and we need to
yes,
keep an eye on it.
yes,
I guess the question then to ask is how long do you foresee taking this for?
I'm not a drug taker. Do you know what I mean? I don't pop pills unnecessarily. So, I mean, it's just, I know it's there. It's my little crutch.
It's your crutch.
Yeah.
Okay. Well, can I suggest if I can give you 3 months this time round,
Okay.
and then we could have a follow-up discussion about that, so making a plan.
Okay.
Is that okay?
Yeah, perfect. I've got to the stage in life when doctors are looking young.
Okay, all right.
Oh dear, sadness.
Well, nice to meet you.
And you.
And then we'll touch base, as I said, in about a month's time.
Oh, yeah, all right.
Have a nice
Nice
day.
to meet you.
All right,
Bye.
bye-bye now.
Oh, a pink sticker. Have you had a flu jab? Very good.
And how are you feeling since all the events with all the bleeding?
I'm kind of lucky to be alive. What happened is I was driving
Yes.
to play golf, and from York to Chester.
Yes.
And I decided to fill up with petrol at the last petrol station just outside Chester. I know it very well. And I got out of the car, I filled the car up with petrol, and I felt a bit giddy, and I thought, oh, fumes from the... Went in to pay the bill, and that was the last I remember. Next thing, I was in an ambulance being rushed to the Countess of Chester Hospital.
This happened in the morning, and by the time we got there, which was about 5:30 in the evening, he was drifting away, he was fading away.
Goodness.
And he was still bleeding,
Right.
purging blood,
Yes.
and they were pumping blood into him. And we were told by one of the doctors that some people stop bleeding and some people don't.
They put 6 pints in.
6 pints of blood.
6 pints.
His temperature had dropped to 60-something over 20-something. And he was drifting away, so I held his hand. I told him to keep awake, stay awake, stay awake.
And had you had any symptoms before any of this?
None at all.
So no pains?
No pain or anything.
Nothing like that?
Quite extraordinary.
Well, it is. I don't know. You've been very lucky, I think.
Have I?
Yes, because I think it sounds like it was a very scary episode up in
It was
Chester.
terrible, terrible. We almost lost him.
I wake up in the night because I just can't get any air into my lungs.
So big deep breath in, and then blast your air into there. 1, 2, 3, and keep blowing, keep blowing, keep blowing. Keep blowing, keep blowing, keep blowing. Stop when you need to. Well done.
With hindsight, it's easy.
Yes.
The only indication I had that there was something wrong is that morning before leaving Yorkshire, I had to sit on the loo, and I thought I had diarrhoea because I was on the loo for a very, very long time, and without being too vulgar, I virtually filled the loo. And I thought, this is diarrhea. I didn't realise it was black blood.
Was it black?
He didn't tell. He didn't.
But I didn't. You know, I didn't think about it.
No. Shall I have a look at this wound?
Yes. Sorry.
That's all right.
The nurse is coming to take the rest of the staples out tomorrow morning. She's a fantastic nurse.
So they took out the whole of the tumour?
The whole of the tumour.
It's all out?
They had to take the spleen out as well.
Yeah, they took out
Yes.
the surrounding tissue.
That's right. I don't want to take this off because I think it's well dressed, but I can see around there it looks still a bit moist, but this end is healing nicely.
I'm on penicillin
now
for the rest of my life.
So it's going to be lifelong, yes. Once it's all settled, there's no reason you can't carry on doing things as normal.
Right.
I think you just have to have a period where you're just convalescing.
The other thing we don't know, haven't had the result of the biopsy.
No.
On the tumour as to whether it was, benign or.
How are you feeling about it all?
Fine.
Are you?
Determined to get back fit, look after my wife. She's a very good nurse,
yes, she is.
but I need to look after her.
Yes.
So.
Right, good. I would suggest we touch base once you've seen the Marsden. Okay.
How can I help today?
I came from France and I forgot my drugs.
So are you just visiting here?
Yeah, I'm just visiting. I'm a sort of temporary patient, and I forgot those 3 drugs. There's a statin and the aspirin, and then there's a blood thinner, but I don't know which is which.
Okay. Can we check your blood pressure now that I've got you in here? Are you just over here seeing family?
No, I had to see get a new passport. My wife just died, and so
I'm sorry.
I need to get back to America. She was American, and uterine cancer. Yeah, and so it's sorting out affairs and doing stuff. And I come over for a sort of a health check, but I'm sorry, this is unscheduled,
Now, while we're doing that, let's do this again. Be nice and quiet for a moment just while we check this.
Oh, okay. Is it high?
It's probably because we're talking, so...
I had it checked about 2 weeks ago.
Now we're talking again and it's gone up, so nice and quiet. Sit back in the chair and no chattering.
All right.
So your blood pressure's 146/94, which is a bit higher than I'd like it. So just when you get back to France, get it checked again.
All right, okay.
But let's give you these medications. So aspirin, tenolol, and then the rosuvastatin, one to be taken at night. Okay, it actually says on here, le soir.
Le soir, yes it does. That's your actual French.
I remember something from my GCSE days.
Yeah, well,
All right.
I didn't even look at that.
And don't take it with grapefruit. That's another one. Don't ever have grapefruit with your statin. It increases the risk of you having side effects like muscle aches and pains and inflammation of the
I have
muscles.
a grapefruit every day.
Oh, I probably would
In
avoid
the morning.
it.
I don't sort of have a spoon or cut it. I eat it like an animal over the sink, so very quickly. Before I have my porridge and fruit and
Not
stuff.
having grapefruit.
Oh, really?
Yeah.
It's bad for the condition, is it?
Bad for the statins because it increases the risk of getting inflammation of the muscles.
So that's a statin, is it?
Yeah, that one's
Well, I
the
take it. I
statin.
have a grapefruit in the morning, so the statin at night would be okay, would it?
I mean, the recommendations are that you don't have grapefruits.
All right. Well, I'll take that on board. Thank you.
Okay.
That's great. You've been great. Thank you very much.
No problem.
Thank you.
Don't forget your wallet.
Bye.
I'm going to take it as a tip.
Thank you. Bye.
See you later.
Is it itchy?
No.
Is it very tender to touch?
Yes.
Can you just twist the top half of your body and just go right round and then the other way?
So you've come for your blood test for your blood sugars. Just relax the hand.
Hello there. Nice to see you. Have a seat. Now, we've called you in for a global health assessment, I think, is something...
Well, yeah, I had to have a blood test.
Well, your blood pressure is certainly perfect. Your cholesterol is brilliant, so the tablets there are working very well. Kidney function's a little bit reduced from normal, but it's very stable. How have you been feeling in yourself?
Not all that, to be quite honest with you.
Mm.
Not all that. My legs play me up.
Mm.
And I do get a pain in the right-hand side here.
Yeah, that's to do with that arterial disease that we know you have. Do you mind if we just check your hips and legs out, if you pop in behind the curtain there for me? Just lie up on the couch and tell me about the dreaded cigarettes.
To be quite honest with you, I started again.
Right, well, that's a little bit of a problem. We know the circulation in your legs is not great. There's a bit of a pulsation here, and certainly none further down. I'm just going to rotate your hip a little bit. Just tell me if it's painful. Okay, well, they're both a little bit stiff, but the problem is still that circulation in your feet. Up you come. I think there's a good reason for asking a blood vessel specialist to have a look at you. I'll arrange a referral up at Queen Mary's, and we'll get that done fairly quickly. Date of birth is 1st of May, 32.
That's it, yeah. 82 years of age.
So during the last month, do you feel down or hopeless, depressed?
Yeah.
Frustrated?
Yeah. Yeah.
How big a problem does that get?
I just have to get on with it, don't I? You know, I used to go to my daughter's in Sussex, but I don't go now. But she phones me regularly.
Right. Does she come up here at all to see you?
Oh, yeah, yeah, but not like she used to.
No.
And I used to go down there quite a lot, but I feel I don't want to go now.
Yeah. And friends? Do you have any friends left of your age around?
Really, no, not really, no. A few of the neighbours I get on with.
Yeah.
But other than that, no. Don't have no friends. So.
It strikes me that your legs are a big part of interfering with your life and making you a bit depressed, really. Mm-hmm. And if we get Queen Mary's to do an assessment, and I think that if we can make your legs better, I think it'll make a big difference to you.
Yeah.
Hi, all right. Come
Yeah,
in, have
good,
a seat.
thanks.
Is it Wesley Stone?
Yeah.
Hi.
I'm going to South Africa for 3 weeks for holiday.
Yeah.
Yeah, so I just wanted to get a prescription for my paroxetine and Namictin.
So you take it for the bipolar, is that right?
Yeah, well, I was diagnosed with bipolar when I was, 16 or 17, but I was taking a lot of drugs at the time. So, I mean, I've been clean now for four years.
That's
no,
great.
longer, 5
Yeah.
years.
Yeah.
I gave up drinking 2 years ago, so I don't even drink You know, I used to get very aggressive for no reason before, you know.
Yeah.
Sometimes if I would feel a bit depressed, I would go and like start punching up a wall, and then like my knuckles would be like all smashed for a couple of weeks. And so instead of cutting my wrist, I would do that rather, you know.
But we're not,
Yeah, but that's...
things are a lot better, aren't
yeah,
they?
I mean, that doesn't even happen, you know.
Okay.
So.
At the moment, are you feeling suicidal or like hurting yourself?
No.
No. Okay, well that's good. And it sounds like you've taken away a lot of the factors that were causing your mood swings, and that as a result, that's become quite stable. Is that fair to say?
There's absolutely nothing wrong with him now. He never gets angry. He probably doesn't even need the tablets anymore because he's like perfectly fine.
So we're in a better place, aren't you?
Yeah.
Have you ever seen a psychiatrist in England?
No, because I haven't really felt I needed to, you know?
Yeah.
And that's the whole reason I changed my lifestyle over the last 5-6 years, you know?
Yeah, and you've done a great job with that.
Yeah.
From what you're telling me.
Yeah.
So shall I give you the medications as you normally take them?
Yeah.
And maybe you can come back and see me after South Africa.
Yeah, that will be good.
And we can make a proper go at reducing these medications. You know, getting the psychiatrist involved when we need to. Does that sound all right to you?
Yeah, that would be good. Yeah.
See when we've got some appointments available when you come back, and we'll take it from there.
And then, yeah.
All right.
So I'll see you then. Eh?
Yeah. All right. Take care. See you later. All right. Bye now. Bye.
Good morning, Putney Mead Care speaking. How can I help you? Okay, hello?
There is. No, you're right.
She hanged up the phone.
Hi there. Hi. Mrs. and Miss Doyle. It's Miss Doyle we've come to see today.
That's right.
Right, this arm. Presumably.
Yes.
Still hasn't really gone down, but it's getting better.
I think it is getting better, isn't it?
The only reason we're
But
back...
it's very slow.
Yes, and it still feels quite hard underneath.
Yeah. Maybe that's 18 millimetres by 18 and a half. I said 20 by 20 last time, so I think this is settling down.
Do you?
It takes a long time, but it is a frustratingly long
Well, I'm
period of
happy
time.
if it's going. We're happy if it's going.
Yeah.
I think she's had so many antibiotics. Don't really want her to have another course because she's had so many in the last.
Well, for this, I've had it for my ear.
Has come back with her mother, full stop. The area of inflammation is reducing. It now measures 18 by 18 millimetres, full stop. There is no fluctuance, so nothing to cut into, full stop. They are to return in 2 months if it has not fully resolved, full stop.
Because she's getting quite a few skin things, do you think some children are just predisposed to? Because you've got molluscums and...
You know, I think her immune system's trying to keep it under control.
Good.
But lots of people need a little bit of help.
So we just paint the stuff on, do we, and then it zaps it?
Cross fingers, yes.
Touch wood.
Touch wood, yeah, absolutely. That is the instruction. Okay.
Thank you, and thanks for seeing us today. Thanks very much. Thank you.
Bye.
Bye for now.
There's no hurry. Oh. There you go. Come and have a seat.
Thank you.
Oh. You're doing a bit of falling around the place. You've had about 4 falls by the sound of it.
And in fact, last weekend, I had to take her to the emergency, Princess Grace, because her ankle was all swollen and her leg was bright red. So I rushed her up to the Princess Grace and they'd given her a course of antibiotics because it got infected.
And is it better?
It's getting better. We've been coming here to have the dressing changed.
Yeah.
I
have blackouts. Yes.
But the last one wasn't a blackout. I think she just lost her balance.
Yeah.
I've actually watched her and she sort of does that, and I think it's
Okay.
just a question of not having balance and
You
strength.
may be absolutely right.
Strength in
But
her.
it's funny that she sort of blacked out. Is that...
Well,
It doesn't tell me I'm going to black out. It just blacks out without.
I know. So maybe going to the Falls Clinic might actually be a sensible move.
I haven't got much longer, have I?
You've got a lot longer. Well, the thing is, you can't depart from this earth by appointment.
No, that is
you have to do it.
absolutely true.
You have to do it when your
Yes.
cards are up.
That's right.
So what we want to do is try and stop you falling over a bit so that you don't break anything.
If you
I
could
mean, that
tell
would be
me.
that would be the worst thing you could do to break something and find
Yes.
yourself in hospital.
Yes.
She's got a care team starting next week who are coming twice a day and are going to take her out for walks and give her a bit more confidence.
And that's helpful to you?
Very, very helpful because I'm completely exhausted. Her mind is getting quite bad.
Yeah.
Her confusion is very bad. Isn't it, Mummy? You get very confused.
But I'm very old. I'm 91. I mean, what else can I?
You remember?
Well, this is why your daughter's organised for people to come in and keep an eye on you, and
Yes,
which I think is very sensible. You know, your
Yes,
daughter's
well, I never had to.
coming over, and she needs a bit of help. Otherwise, if she gets overtired,
Yes,
then,
of course.
then it's not going to help.
I'm not
her.
a young woman anymore, unfortunately.
No, you think she's still a spring chicken, but she's
40 something.
No,
That's a young.
No, I'm 65,
Oh,
Mummy.
really?
Yes.
That's the problem, is that we're all getting a bit older.
What can I do for you
It's
today?
only a stupid thing. My toes got infected.
So that's an infected and growing toenail,
Oh,
I
is it?
think.
Can we keep the toe?
You can keep the toe.
And about 10 days ago, I had athlete's foot. Now I'm faced with intense burning and intense irritation.
It's hot. My feet are hot.
So it's like burning like fire.
Mainly under my toes.
You've got quite a lot of breaks in the skin. This may be a little bit of residual infection.
That's a little verruca. Don't worry. Does it hurt you? No.
This swelling you were pointing out?
Round there.
Yeah.
There.
Okay, okay. So,
Oh, I'm sorry, I've given you the wrong foot.
Hello. Peter, hello there. Have a seat. Just trying to see when I saw you last. I think it was about 10 years ago. We've spoken on the phone since then, but obviously something fairly dramatic's happened. When did they formally tell you that it was lung cancer?
About a month ago.
I think you'd had a scan that was pretty suspicious.
I've had a scan, I've had biopsy.
Right.
It's a lot. I got fed up with it.
Right.
Really fed up with it.
Yeah.
Well, like chemotherapy, I didn't want to go through it. I refused it because I think they turn you into a zombie.
Obviously, without treatment or intervention, it's going to get worse.
Yeah.
The specialists wouldn't impose treatment on you that they thought had no chance of helping in some way.
I haven't heard of anybody having chemotherapy and all the rest of that survived. They all died.
Mm-hmm.
And even if they operate, there's no guarantee either.
No, no one can. If people promised you that it would be okay, they'd be lying. So
I won't believe them.
Who's the consultant that you've been under?
Dr. Poppet.
So have you seen Dr. Poppet?
No.
No. Is there an appointment?
On Monday.
I can't see any use of
He
seeing
doesn't want
him.
to go.
It would help me a lot.
Would it?
Yeah.
Oh, well,
Because it's got to be a balance of the benefits against the negative effects. You know, if those side effects were short term, but we're going to give you another 3 years.
The side effects can make you vomit. lose your hair, diarrhea, and many other things. Yeah. I mean, I don't want to go through all that.
Well, you know, I can't make that decision for you, but I think that you shouldn't make that decision without having the input of a cancer specialist. You know, you're sticking your head in the sand a bit. The most challenging patients in general practice, I think, and those that generate the most emotion are situations where you can't make much difference to their outcome. By and large, though, the overwhelming emotion seen is of strength and courage. You've got the power, not me and not him. You know, it's your decision at the end of the day. But I think that we shouldn't make it without all of the right information.
If that's all it is, okay, I'll go and see him.
The pain, you don't need any painkillers?
All I use is Anadin.
You got, right. A lot of prescribable medicines, but I think we'll wait and see what Monday brings. Okay?
Thank you.
Peter? Yeah. So it's been a long time, but I think we'll be seeing each other fairly frequently.
Are all doctors healthy as well?
No.
Thanks
Okay.
a lot, Doctor.
Yeah. Okay. Thanks. Bye.
Hope you're feeling better soon.
Thank you.
Okay. Cheers now. Bye-bye.
Well, good luck with your Spider-Manning, all right? You're going to sort all the baddies out. See you later.
Thank you very much.
Bye.
See you again.
Thank you very
Cheerio.
much. Bye-bye.
I'm suffering from really bad anxiety. As soon as I get into public places, I can't breathe.
Does it look irritated?
No.
Honestly, not at all.
Not really, no.
So I'm going to get reception to call an ambulance, all right?
I was wondering if it might be possible to have a little wee for me.
So little.
I know.
That's too little.
I can have, say, a couple of boiled eggs and toast, 2 cups of tea. That can do me for 3 to 4 days.
Okay, here we go.
Take a seat for me.
Right, I think you spoke to my colleague Dr. Sayer earlier on today and saying you're really low in mood. What's going on?
I don't know, like literally for the past couple of days, I can't leave the bed, like I had to leave work. And I'm suffering from really bad anxiety. As soon as I get into public places, I can't breathe.
Okay, is this something you've had before?
I used to have really bad depression, like from when I was 17, I got diagnosed with it, but lately it's just coming back. Like I don't want to leave the bed, I can't eat, I'm not.
So nothing's changed in life or nothing new, it's just...
It's literally, I woke up and I didn't want to leave the bed. I feel like I'm scared of something, but I don't know what I'm scared of.
Are you taking anything for it?
I stopped taking them ages ago, but I don't know what triggered it or what's sort of going on.
All right, well, we need to sort this out here. Why don't we give you a bit of time off work so that way you don't have to keep
I'm just worried because obviously I'm new to there and I don't want it to be a thing where they fire me, but I literally can't. Like, earlier on when I called in, I literally felt like everything was about to fall on me. My chest got tight and I had to literally like strip myself in the bathroom because I didn't know what was going on. Like, I felt like the walls were sort of caving in on me, and I've never had anxiety. I've never ever suffered with it. It's never happened to me before.
Have you got anyone at home with you?
I live with my nan, but it's like I don't want to stress her because she forgets things anyway, so it's really bad.
We'll sort this out. It's all right. We'll sort this out. With regards to work, I don't know what you'd prefer because you can take self-certified for 5 days. That way you can say whatever you want to say.
Well, like, I might need a few days just to gather myself. And it's something that's documented that I've struggled with for years. But right now I'm scared that it's only going to get worse.
Okay. All right.
When I was younger, I would literally lock myself in the bathroom and they would have to call, like, the police and stuff to come and get me out. And I don't want to go back.
We won't go back to that. We won't. It's all right. We're not going to go back to that. We're going to sort this out, all right? Sounds like we need to start you back on something again, and maybe get you in touch with some counselling again. Have you had counselling in the past, yeah? Okay, well look, most people have started on either sertraline or citalopram.
That's the only one I had before.
Would you like to try that one again, or would you like to try something different?
I think I might want to try something, only because when I started on that, it's like it got worse before it got better, and it wasn't.
Yeah, it can, just warning you, all of them generally make things a little bit worse to start with, but let's try the new one anyway. But just to warn you though, those first 2 weeks generally make you feel a bit more rubbish. There are other things like propranolol and diazepam that you can kind of take if you're getting a bad panic attack. Problem with diazepam is it is addictive in nature, so it's the kind of thing we can only really give you kind of a few tablets of. Or there's propranolol, which helps like slow down your heart rate and stops that whole like fluttering thing. They're not addictive necessarily, but it's not something you want to be on long term. It's just maybe might help at the moment whilst you're feeling so panicky. Would you like to try either of those?
Yeah.
Do you have a preference of which one, or you're happy to give either one a go? Okay, let's try propranolol as well. Oh, have you got asthma?
Yeah.
I just wonder because propranolol, it can sometimes make asthma a bit worse, and so I don't really want to give it to you if your asthma might get triggered off, so I'm not going to use that one. All right, if I give you 7 tablets of the diazepam, I said they can be addictive, so please just be careful. I only take it if it's really bad. Okay. Now I'm going to just give you a telephone number to get counselling as well, okay? All right, so give them a call as soon as possible. And come see me again in 2 weeks, having started all of this. Obviously, if things get worse in the meantime, just call us, okay? Like you did today. If things don't improve, just give me a call.
Perfect, thank you so much.
That's all right. Good luck with all, okay? Let us know how it goes.
My asthma's been quite bad recently.
Could barely breathe, just really tight chest.
And then, all of a sudden, I start to cough. I was short of breath.
I felt like my whole chest was like a balloon that I just had too much air in. I couldn't get it out.
So it just like, instantly I'm just like, I can't breathe.
So your asthma is not good?
No, it doesn't feel too great. I just feel really kind of just tight.
You sound terrible. Yeah. How long have you been like this for?
It was bad last week, and it felt a bit better. And then probably, I think, Friday last week, it felt not so good. And
How many puffs have you had today?
About 6.
Okay, I'm going to get you a nebulizer now so that we can talk a bit more, okay? I might need to come and sit here, Mum, just so you're next to the... I can plug this in. All right, one ready. I'm just going to plug it in for you. You feel it coming? Okay, so just some nice deep breaths for me, okay? How long have you been breathing this fast for?
today and yesterday, I think we're probably going to need to send you in because we're not winning. You're at that point now where potentially you could get so exhausted that you'd find it hard to breathe at all. We're going to get reception to call an ambulance, all right? Just going to have the door open, just in case you need us. Can we get an ambulance now? Blue lights, yes, please.
For now?
Yep.
What's wrong with them?
Room 6, severe asthma attack.
Severe asthma attack.
She's got respiratory rate of 60, despite a nebulizer tell them, so they need to come in now.
If someone comes in an emergency situation, the sort of human instinct is to panic, but this is what we're trained for. And I have worked in A&E, and we are GPs, we are very highly skilled. So although it doesn't happen as often in general practice, it still happens frequently. So your adrenaline is pumping, but you don't panic. You need to stay calm because you need to assess the situation, work out what needs to be done immediately, because there's lots of jobs to be done and it needs to be done quickly, but safely and calmly.
Tony speaking, how can I help?
What's your date of birth, please?
Vicky speaking, how can I help?
She's on 40 milligrams of prednisolone, has been for 7 days, and things have got worse rather than better. So we're back at our limit again from what we can do in the community. Thanks ever so much. Okay, bye-bye. Bye-bye. Hi. All right, lovey. Hi. So this is Miss Gorey, who's a known brittle asthmatic. She's normally on 10 milligrams of prednisolone every day, but she's been on 40 milligrams for 7 days, despite which we haven't really got on top, as you can see. So this is after a 5 milligram nebulizer. She's still got a respiratory rate of 60. All right, I hope it gets better soon. Okay. Thanks, guys.
No worries.
Thank you. All right, thank you, guys. Good luck. Take care. Poor Love, she's just breathing so she's terrible, so fast. Really frightens me when they're that bad, because, anyway, poor Love.
Relief in one sense, when the door closes and the patient's gone with the ambulance crew, they're safe, they're going to hospital, that's what needs to happen. Sometimes a sense of kind of, not anticlimax, but almost, because you've had this adrenaline, everyone's been rushing around, we've looked after the patients to the best of our ability, and now they're in someone else's care. But actually, you then have to take a deep breath and realise that probably you're running late, because this has taken, understandably, way more than 10 minutes, potentially 20, 30, 40 minutes. So then you kind of take a deep breath and have to face the day explaining to everyone. Hopefully, most patients understand, but it can be quite stressful then.
Hi, how can I help?
I've just been waiting a while now. Didn't know if you've got me.
Yeah. So, because there was a medical emergency a while ago.
Yeah,
you'll
the
be
line.
next. She just seen someone else. Sorry about the delay.
Don't worry.
Thank you so much. Bye. I can't decide if my headset's playing up or I'm speaking to a lot of deaf people today.
What do you think it is?
I think it's the headset. But then I speak to somebody else and
it's
everything's
fine. Yes. Do you like stickers?
Yeah.
Do you think you'd like a sticker?
I would like a sticker.
Oh,
Can I have
a sticker? Yeah, you can have a sticker.
For you.
Even though you didn't have an injection, which one would you like?
Now, would you like a sticker?
No.
No? That usually works.
Come in. Sorry? Oh, yeah, of course you can have a sticker. Look, I've got flowers, butterflies, cars, dinosaurs. A dinosaur one, I think that's a great choice. There you go. Can I have a high five? Very good.
Right. Are you going to tell us what's the problem, or are we going to leave it to your dad?
I don't know what the problem is. Mummy might. I know what the problem is. So when I was at school and the door was open and it got really cold, then I was cold, so I put my jumper on, but that didn't work.
Oh, okay.
But everybody else was in t-shirt, weren't they?
Yeah.
So you were feeling cold, were you? Because Because, I mean, it's been sunny the last few days, hasn't it? So, do you feel any pain or soreness or...?
I'm okay.
You're okay, you're fine. Can I get your dad's take on things?
Yes,
See what he reckons.
Obviously, they saw him putting on a coat when everybody else was sweating, so
yeah.
They took his temperature and he was very hot.
Okay.
They gave him some medicine, but as soon as the medicine wore off, he spiked again.
Yep. I was wondering if it might be possible to have a little wee for me. Let me give you a pop.
That's so little.
I know.
That's too little.
It's practice, isn't it? I'll set you that task if I may. Any success?
We have.
Oh, look at that. What I do is I just dip my little bit of paper. It's quite clever stuff, really.
It's easy, isn't it, Dad?
Yeah.
It's easy being a doctor. Okay, there's no urine infection.
Okay.
I think where it's coming from, it's a viral infection of the upper respiratory tract, and there's a tiniest little bit of redness in the ear at the back of the throat, and he's got a few lymph nodes up there. It's almost certainly going to settle down on its own.
Okay.
So it's just a question of keeping an eye on him over the weekend. So keep him well hydrated. Calpol's absolutely fine. These kind of things usually take between about 5 and 7 days to settle down completely.
Cheers, thank you.
Have you got any questions for me?
Have you got any stickers?
Right, what are you going to have?
Okay, cheers, thank you very much.
Nice to see you, babe.
Thank you.
Take care.
Thanks a lot. Cheers.
It's a pleasure.
Bye.
Bye, take care.
That was easy, wasn't it, Sam? That was easy.
Yes, well, it wasn't a test. He's just trying to make sure that you're okay.
Yeah.
Does it sound any different if I talk to you on this?
I can't hear you at all.
Ah. And you can hear me okay on this one?
Yeah.
Okay, thank you.
You're welcome. Antonio speaking, how can I help?
Hello, Miss Morrie. Hi. How are you?
I'm not too bad now.
Okay.
If I have something to eat, and then I have to go and pass a stall.
Yeah.
The pain that I get, it's like you're open, but you're not closing up. I don't know, like it hurts a bit.
But no bleeding from the back passage or anything like that?
No. That it can happen, but that's very, very rare.
Okay.
That's just rare, that is.
And we spoke last week, obviously, about alcohol as well.
Oh, yes.
And that's still something you're taking daily?
Not daily, but every other day or every 3 days. Yeah, I do. And my roll-up cigarettes.
Yeah.
You know. Personally, Doctor, I can't see that changing, really. The only other thing I can say is my diet is very, very poor.
Yeah.
Because I do not stick to a proper diet. I can have, say, a couple of boiled eggs and toast, 2 cups of tea. That can do me for 3 to 4 days.
Yeah.
I don't want anything else. I have no desire for it.
And you said last week, there wasn't any problems with any food sticking or anything like that?
No.
No problems with swallowing?
No.
And obviously you haven't got a huge amount of weight on you?
No.
But you hadn't lost any weight or anything like that?
No, not to my knowledge. No.
Not to your knowledge. Given the fact that you smoke a fair bit and drink a few times a week, we know that there's an increased risk of things going on in the stomach, and that includes things like stomach cancers. Okay.
Yeah, I've thought about that.
Yeah.
It won't hit me like a ton of bricks if I find out something like that. I've had a good innings.
Yeah. But I think we should investigate that a little bit further. Even without those blood results to look at, I think we should be referring through to the hospital for somebody to pop a scope into the stomach to have a look. What do you think about that?
Yes, but why not?
Because we've talked about things like stomach cancer, it's something that the NHS really does investigate very quickly and very comprehensively. Do you think that's something that we should refer you for?
Yes, I think so, Doctor.
Yeah. I think that's important.
Okay, then.
How's it going?
Kim, Erin and I were just saying you've been so... You look like you two were kissing and then you turned around. Erin, like, she cool.
Hi. Oh, careful. Sorry you had to walk a bit further down. How do you think I feel?
Oh.
Been a while since I've seen you, hasn't it?
Yeah.
Lucky you.
I know. Let's hope I'm going to be bloody lucky
Have
now.
you missed me?
Oh, yeah. Well, I miss you, but not miss coming round here.
Can we do your left arm? Because I know from previous...
I know.
I think I know your arm better than you do.
You don't. Oh, that went in nice.
Didn't even feel it, did you?
No, I didn't. See, that's why I like you.
That the only reason?
No, I like you as a
I was going to
person,
say.
And as soon as you got that colour...
using me for my blood technique.
Definitely.
You like my hair colour then, he said?
Yes, I do. I used to be that colour when I was young. A natural colour, though, it was, until I...
Have you ever seen my natural hair colour?
No. Black. Brown.
Ginger.
Ginger? Not a bit of an Irishman, are you? Any holidays yet?
Yeah, I'm going away in 2 weeks. Where do you think?
Turkey.
There you go. You know me so well. GP surgeries do become like an extended family for elderly people because they do come in a lot more than some younger people. So they do get to see like me, a healthcare assistant, a doctor and a nurse. And they have different relationships with all of us. So that is like a family in itself. So I'm probably like the little naughty grandson, and then one of the nurses could be this. You know, that's how they see it. And it's like a day trip for some of them as well. They get a bus in together, some of them. So yeah, it's quite sweet.
Well, my niece got married, not last week, the week before, in Spain. So I've got another one getting married in Spain next year.
Are you going?
No, I never went to this one. I said, I won't be able to come to that. We'll get you a wheelchair at the airport. He said, we'll get you there. But
I need a wheelchair at the airport as well.
I need a wheel. I need everything at the bleeding airport.
By the time I'm done on the plane, I need one.
Taxi there and taxi back and
Oh,
comfort.
lady of leisure.
Definitely.
Look at you.
Well, you know why I say I might as well spend it because they'll spend it when I'm gone. Nice seeing you.
Oh, you too. Always lovely to see you. Take care.
Will do.
You got a paper?
Yeah.
I want that crossword finished by the time I come out there.
Yes, take it home with me.
Thief.
Bye-bye.
See ya. Even from when I was on reception, I always thought, try and make somebody leave here happy because you never know what they're going in to see the doctor for. It could be anything from bereavement to cancer. So making somebody's time here happy, I've always thought is very important.
Aaron speaking, how can I help?
Right, have a seat. What can I do to help?
I had some fertility tests last year and I got given the results. It was when I was with my ex-girlfriend. I went to a specialist and he explained that I was kind of slightly below average but in normal parameters. But then when she went back, there's another doctor that she spoke to who said, no, the specialist is wrong. You need to get a second opinion. And they said, yeah, those results are on your record, so you could explain them to me.
Right. So we're wondering if you do or don't have a problem with your sperm.
We are, yeah.
OK. I've got a set of sperm results from the 1st of May.
I mean, looking at some of those numbers to me, obviously it looks devastating when you look at the low figures.
There are two numbers which are not as high as we want them to be. The first is the number of sperm which are swimming in the right direction. And what you want is more than 32% of sperm to be swimming in the right direction. And only 21% of yours are.
Right.
The other thing which is not ideal is this number of normal forms. What that means is they look down the microscope at the sperm and see if they're the right shape.
Yeah.
They didn't see any of yours which were the right shape. So I guess we've got a couple of choices. I think there is a lot of variation in these samples, so you could do a third test. Another option is for me to contact a urologist and give them all the numbers and say, what's the situation? This is one interpretation. What does this actually mean
Okay. Well, that's definitely the first step for me. And can he give me more of a breakdown as opposed to just a, you know, I don't know, just sort of more of an explanation, because I still don't really understand that.
What would, in an ideal world, what would you want them to be able to say?
I want to say you've got this percentage chance
of having a kid.
Yeah.
Okay.
I think anyone in their right mind would want to know.
Yeah.
I want to have an idea.
Yeah, I understand where you're coming from.
You've been in hospital, you had your tonsils taken out first of all.
One.
One, the right side, yes.
The right side, and I'm too beg your pardon, sorry.
That's okay.
It's been in constant pain ever since, and then about 3 or 4 days later, I just cleared my throat and an enormous volume of blood suddenly appeared.
Oh my goodness, okay.
So I had to call the 999, taken back to the hospital.
Thank you, Bridget. Okay.
Initially I was scared it might be an internal, but it wasn't. The bleeding was actually
From there.
From there.
Okay. So you've got here, you're seeing the Royal Marsden Hospital this Thursday, okay.
He's going to have, I think it's 20-something, lots of radiation.
Yeah.
And then the second for 5 days a week for 6 weeks.
Okay. Yeah.
And he's also going to have chemotherapy.
That's a lot.
Just a damn sore throat, that's the known bit.
Okay, so it's the pain that's the biggest issue for you at the moment.
It can be, especially at night time.
You're on the omeprazole, the propranolol,
Yes.
The calcium and the vitamin D, and then the bone alendronic acid once a week. And then importantly, painkiller-wise, is the cocodamol. If it's difficult swallowing tablets, do you want to keep it as a tablet form?
I prefer, I had a choice of that or of my bum.
Oh, Charles.
I did. So I quickly learned how to swallow.
As an alternative, a third option, you could have dissolvable tablets or liquid.
No, I'll stick with the tablets.
The tablets, you're okay swallowing
absolutely.
them? You can make them a little bit stronger if you want.
Just slightly stronger. if
Slightly
possible.
stronger, yeah.
But again, just for the occasional rise.
Just for the occasional, yeah.
Absolutely, no other reason.
What else do you need to...
No.
Yeah.
My sister, one of my sisters, she's critically ill in Ireland.
You told me on the phone, yeah.
Charles is my first priority, obviously. I can't leave him at all, and I wouldn't. But I need to go over to Ireland if I can. If Charles's sister came and stayed, which she will, all the time in the house with Charles while I'm away, do you think that is...
I think that's fine.
It is.
I think that's absolutely fine, completely.
Yeah.
If Charles was happy with
Absolutely,
it.
absolutely.
And you have...
Absolutely,
yeah.
of course.
It would only be for 2 days.
Okay. You know, your sister, she's very unwell, she sounds... And you need to...
Yeah.
You need to go over, and if you've got somebody... Not the child you need looking after, but I think it's nice to have somebody else there. You've had a very difficult time and you're going through a lot, and if your sister can come and help... I'm a very different patient. You're not a difficult patient. You're not at all. We would like to support carers as much as is possible. It's often a very unrecognised role across the UK. They estimate 6.5 million people are carers in some form or another to friends or family, which works out at 1.1 in every 8 adults in the UK. So it's a huge proportion of people. Often people might not recognise themselves that they are carers. They may be providing a caring role but not think of themselves as a carer. So one of our roles is to try and identify people who are providing a caring role and try and support them as much as we can. I think you're coping, from what I can tell, very well. And I know
good Lord, I've got a lot to do yet. Right, but we won't
Sorry,
take any longer. Thank
okay,
you
no,
so
not
much
at
for your
all.
time.
Perhaps we could see you again maybe in about 2 or 3 weeks.
Oh,
we
great.
could do that.
Yeah,
and then,
that's very kind
but
of you.
anything in the meantime, I'm
You're
happy
so
to keep
kind.
going. Not at all.
Thank you very, very much indeed.
No, okay. All right, bless you. Oh. Okay.
Thank you.
All right.
Thank you for all your kindness.
You're very welcome.
Take care. See you
You
soon.
take care as well. Okay.
Bye now.
Bye-bye.
Bye-bye.
All right.
Vicky, I'm going to win the lottery, okay? I just thought I'd tell you.
Just in case you do, I just want to let you know how much I like you.
Who are you?
If you feel you need to be seen, and I can arrange for an on-call doctor to call you. If they need to see you, they will arrange a time for you to come in.
Perfect.
To practice.
Yeah, practice it in front of the mirror.
Hello.
Hello, Bridget, how are you?
Not too bad. Could you give me a printout? Oh, I think he needs tablets too.
This has lots of right away to Portugal.
Oh, thank you.
That's your missing link.
That's lovely.
You know how long
I nearly lost Charles on Wednesday. He had a massive bleed out. He had to have 5 units of blood.
How are you?
I'm all right, I'm in bits, but he's in there now. He woke up and he said, Bridget, my nose is bleeding. He came down the whole of my bathroom, the sink, the bath, the walls, the floor. The paramedics never seen so much blood. And the paramedics thought he was gone because he just went. Oh, Kim, I really thought I was gone myself. I couldn't bear it anymore. He is going to bleed again, and that's why because my sister is really ill in Ireland. I can't leave Charles on his own at all now. Oh my God, you never see the blood. And Charles was sitting on the side of the bath, and he just went. His eyes and his
Roll
true
backwards.
back. And the paramedics were saying, Charles, are you with us? Are you with us? And I was screaming, I love you, don't leave me. Oh. I'm out, but I just thought, you know, what am I going to do? But anyway, I know, but I'll be all right, you know, I have to be.
I hope that Bridget feels she is getting enough support, and I hope that she feels she would be able to speak to us or a Carers Association if she needed more support. We try and keep regular contact with her to ensure that she is okay and that Charles is okay. I think one of her strengths is she's able to be open with people about her feelings. She doesn't keep things closed in, and it's nice that she has a relationship with some of the staff at the surgery here where she can talk to people about how she's feeling, and I think that's an important outlet for her.
I can't fix my hair up.
Brush it.
I have.
No, you haven't, Pa. Brush it properly.
Watch.
That's not brushing it. It's not even black. How are you not black? This is brushing.
Yeah, but ow!
You have to brush it. It's called brushing.
Don't. You're hurting my scalp.
Oh, shut up. See, that's what it's called brushing.
Yeah, but I don't want it flat like that.
It looks nice. It was sticking up before, like the Mad Professor. You look like the Nutty Professor.
You are the Nutty Professor.
It looks nice now.
Yeah.
Mr. Morey, hi.
Hello, Doctor.
Hi, come in.
Thank you.
Come in, take a seat. Okay. And Miss Moore, how are you feeling?
Not good, Doctor.
No. Lots of problems throughout the tummy. Is there?
All round here. All this. Oh, it feels like I'm on fire.
Okay.
I tried to have some soup yesterday.
Yeah.
4 spoons, that was it.
Yeah.
I put the rest back into the fridge.
Okay.
I've got no desire.
Yeah.
I've got no desire to eat, and I'm tired of the pain. I'm fed up with it.
Did they talk to you when they did the endoscopy? Did the man that did the endoscopy talk to you about what they saw?
No, they just told me, they said a slight tear in the small intestine.
Okay.
I've got nothing for praise for those people.
Indeed.
They're very good.
Remember when we said that we were making the referral very urgently because we wanted to know what was going on with this symptom? That there's always a possibility of a cancer or something like that in the stomach.
Yes.
It did show something like that. It wasn't the typical sort of cancer that you see in the stomach. It was something else. It was a type of lymphoma. Okay. On the plus side, it's not one of the very aggressive things that happens. So I think that's the most important thing to think about at the moment.
Yeah.
Okay.
Whatever comes my way, comes my way. I knew this was a year for me.
Yeah.
I knew this was. I knew.
In what way?
This was the very year back in 1980 when my dad was my age now, 59, that he passed on. And now I'm 59.
Okay.
And I thought there was something in this.
Yeah. This type of cancer in your stomach isn't one that typically is very aggressive or anything like that.
But it is a cancer.
It is a type of cancer, yes.
Ah, right.
Okay.
I don't think they'll ever see me in work again now.
Okay, well, don't worry about work at the moment. Put that to the back of your mind. Okay. Let's focus on what's happening at the moment and what's going to happen next. So we got the letter from, let me show you the letter from the hospital.
Yeah.
So
I'll let you read it out, Doctor.
Yeah.
I can't look at the screen.
you take your time. Do you want a glass of water or anything?
I'll have a glass of water, please.
Let
Thank
me
you.
get you a glass of water. Just take a second. I'll be back in a moment.
Thank you.
There you go.
Thank you, Doctor. There.
No worries. I think it's difficult talking about these things as the general practitioner and not the hospital doctor, because we don't have as much knowledge with the specific points around this.
Yeah.
But it's worth us talking about this today. Yeah. And then we can, be here to support you over the next weeks and months.
I mean, I've got to the point now where I don't really care.
Yeah. This is, as I say, it's not one of these very aggressive cancers. So it's not something that somebody needs to, go in and cut it out straight away or anything like that.
Oh no, not under the knife.
Nothing like that. Nothing like that. Okay. Take your time.
I've had illnesses before and I've had colds and things, and I've got over everything. But I'm not getting over this one.
No, this is one that you can get over. So this is not one of the very worrying types of cancer. So this is one of the things that is often very localised. It's very slow changing. And there are lots of treatment options for it. After a patient hears the word cancer in a consultation, they're not going to take on board much of what you're saying. It's obviously beneficial to try and provide some information about what might happen next, but we just know that at that point in time, they're not going to take on board much of what we're saying. Obviously, one of the great things about general practice is that we are there later that day, we're there tomorrow, the next day, and that we're easily accessible.
If the worst comes to the worst, with this, as John Wayne said, the big C, to quote, how long would it take to happen for me to,
No, it's not one of those things to think about at all at the moment. Obviously, these things go through your mind.
I'd rather know.
So this type
because I'm not feared of it.
Yeah. This type of cancer's very treatable. The problem with cancer is that it very much does feel like one condition, that this is cancer and it's terminal and this is the end of my life. Whereas in truth, there is so much variations between cancers, how early they're picked up, the types of cancer, that it becomes much more difficult to understand. And as soon as we use words like cancer, patients unfortunately always fear the worst.
I'm not going to drag myself all the way through this for a long period of time. As long as I know what is what, that's good.
Yeah.
Because I can prepare myself.
The difficulty is there's a lot of differences between each type of cancer. And therefore there's a lot of differences in outcome. Some cancers are very slow changing.
I'm not going to bleeding go through a long suffering process and whatnot, because I will tell you now straight.
Yeah.
I will tell you now. I'll make myself a cocktail, right? And I will go out overnight.
Okay.
I promise you. That's what I will do. Oh yeah. Make no mistake.
It's Maureen. Come on.
I don't want to waste anybody's time here.
You don't waste anybody's time. We're here for you. And we're, as I say, our door's always open. You can give me a call at any time when we're here.
Yes.
And I would always see you at short notice. What I want to suggest now is that it would be useful if you came back at lunchtime and then we had a chance, you know, if you've got any more
Today?
questions. Yeah.
Yes, I can make it.
Between now and then, I will have spoken to the consultant, and then we'll have a bit of a plan, and then we can get things going forwards together.
Okay then, Doctor Ed.
Okay.
If anything happens to me, in the meantime, or anything like that, please give my regards to Dr. Shard.
We're not thinking like this. We're not thinking. It's just.
Please give my regards to him.
Oh, come back and talk to me at 1 o'clock, and we'll have a bit more of a discussion about things, and we'll try and put things into more perspective.
Yeah.
At the moment, it's, you know, the more I talk, the less you'll take on board.
Yeah, I'll be in it then. I'll be in on time.
Yeah. Take some time. Come back in at 1 o'clock.
I will.
And I'll see you then.
I will, Dr. Ed.
Okay.
Thank you very much for your time and your concern.
No, not a problem at all,
appreciate
Mr. Roy. You know, these are the most important times.
Thank
and
you,
that's
Dr.
why that's why we're here.
Thank you.
But
and if you see Dr. Shard, give him my regards.
I'll send you a regard. Pop in and see me at 1 o'clock.
I will do.
And we'll talk further.
I'll be here. I'll be here about 10 to 1.
Okay. See you then. Take care.
Thank you. Thank you.
Take care.
I'll see you soon. Thank you.
Indeed. See you then. Shit. Shit. Hi, Dr. Barker. It's William Laird. I've spoken to him about the results. He was quite distressed, so I'm quite a little bit on edge at the moment. But I hope he will come and see me at 1 o'clock. You know, but then I'll panic a little bit if he doesn't. maybe I'll pop round the corner to see if he's at home. Yeah. Pleasure to talk to you once again. Thank you. Bye then. Bye. I think breaking bad news it's always a complex thing, whether or not you've known the patient for a matter of days or hours or months and years. It's just unpredictable how you're going to respond to this and how they're going to respond. And it's really just trying to provide information and let them know that you're there for them at their time of need.
I didn't win the lottery.
I still like you though.
Yeah, I'm not going into the I'm not going to go to the meeting.
Okay.
If my patient comes in, will you just let me know?
Okay.
He said he might come. He said he'd come back at 1 o'clock.
Which patient's this?
Mr. Murray.
Okay.
So, let me know when he gets here if he does.
Hello,
Hi.
Hannah. Come and have a
Thank
seat.
you.
How are you? What's happened?
I don't know, my eye, and I think I might have been a bit overdramatic coming straight to you, but one of my eyes, it just started like, it felt like there was something in it. And I've spent ages putting my finger in it, which obviously hasn't helped. And then I thought it seemed like there was something in it, but it looks like, I don't know, you look at it and you tell me.
Right.
It felt like there was maybe some like fluid, it was been really watery, but then it seemed like there was some creamy coloured.
Discharge.
Yeah, but not much.
Okay.
And then that bit there seemed really red, but I have poked it a lot because it was just literally, my eye was just watering because it just feels like there's something stuck in it.
Okay.
How does it look?
Looks okay. I'll have a look in more detail though.
Okay.
I'm just going to pull your eyelids down a little bit. Look up for me, and look left, and look right, and follow my finger with your eye. Okay, come and have a seat for me. So...
There's nothing wrong with it, is there?
Well, I can't see anything there.
Oh, okay.
I guess you've got this sensation of your eye being irritated and
Yeah.
sore.
Does it look irritated?
No,
Honestly, not at all.
not really, no.
Oh, I was spent all morning looking at it. It feels like something here is like rubbing every time I'm moving my eye around, but obviously not enough for me to not want to move it. Do you know what I mean?
I do. I mean, if we were going to completely exclude a foreign body having scratched the front of your eye, I guess we would need to stain your eye with fluorescein and look at it under a blue light.
Yeah, that seems a bit much considering I feel like I've never rubbed, there was never an opportunity for something to actually go in it.
No.
Okay.
I agree, it feels like a bit much.
It does feel like a bit much.
Because your eye essentially looks completely fine.
Yeah.
Does anything particularly seem to trigger it?
I thought maybe Pinot Grigio would be a trigger because every time I seemed to drink that I would get a headache afterwards.
Can you put your hands behind your back as though you're doing your bra?
I can't put my brow that way.
That gun,
Yeah.
will it increase my CO2 emission?
No.
I buy some, what they call Dr. Chicken nuggets. I eat, like, say, 30 of them in one go.
That's quite a lot.
It's making me anxious. I'm a nervous wreck. I just can't stay there.
Why not?
I feel vulnerable. The house has been broken into before.
I started having a panic attack and thought, oh my God, maybe I've got like ovarian cancer because it really hurt.
I mean, that's the most terrible bruising I've ever seen.
Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising.
Good morning, Nana speaking. How can I help?
Hello, hi. And what's brought you in today?
I've got a bit of a sore throat. I've had flu for about 10 days. And I'm going on holiday tomorrow. So the last time I went on holiday and then I had a niggle. It turned out to be something really big. So I just wanted to get it checked out.
Okay. It certainly sounds like laryngitis, that loss of voice.
Yeah, I've been able to talk a bit more today, but I completely lost my voice since Saturday.
Okay.
It really just doesn't feel like it's getting better.
Unfortunately, so the things like the laryngitis is typically more with a sort of loss of voice. It tends to be caused by viral things as opposed to bacterial, and not something that gets better with any medication. But we'll certainly have a look and see whether or not we should go down the route of anything.
No, it's fine. I just wanted to check it out.
Okay. 36.8, so that's nice and normal. If you open up nice and wide, it's not terribly exciting at the back. So the tonsils aren't huge. There's not loads of pus or anything along those lines. And if you took your head forwards, where are you going? Are you going somewhere nice? Or...
Going to Lisbon for a hen weekend.
Okay. Yeah. Hen weekend like this? No.
I organised it, otherwise I wouldn't go.
Not the best combination, unfortunately. Stand up and let's have a listen on your back. If you, is this a dress or?
Yeah, it's a dress.
Well, we can probably listen from the top if you slip your cardi off. Okay, perfect.
Yeah.
And some breaths in and out through the mouth. Yeah, chest is clear as a bell. So what happened last time? What were you worried about from last time? Where it was sort of...
I just had a sore tooth, but by the time I got there, it turned into like a wisdom tooth. And I just felt nothing was open because it was Easter.
Yeah.
I just spent the whole time in agony.
Yeah, you're doing exactly the right thing at the moment, which is resting the voice and not shouting at anybody, limiting your alcohol intake in this hen weekend.
When you say limiting,
well,
realistically.
Do as you feel is right.
Okay. Is there anything else I can do?
Things, you know, sort of sometimes, you know, from a pain point of view, gargling aspirin is the best option.
Okay.
But other than that, there's nothing. It is just resting the voice and time. If you go to either NHS Choices or patient.co.uk websites, there's loads of advice on there. And if you just put in laryngitis, which is what this is, and it is just time. It's really the key.
With the flu that I've had.
Probably just incidental. Your immune system was probably knocked with the flu, and then you developed this infection.
All right, thank you
so, yeah, enjoy this hen weekend.
I'm going to make some signs.
Well, you need, sort of a standard set of signs and go from there. Take care. Take care. Bye then.
What's your date of birth, please? Oh, happy birthday!
Come and have a seat. I'm Dr. Beecroft. Sorry to keep you waiting.
Don't worry at all.
Right, what are we up to this morning?
Okay, so basically, I suffer from migraines.
Okay.
And I have been since I was probably about sort of 16, but very, very rarely.
Okay.
Just recently, I get them all the time.
Okay.
And there's not a point where I pretty much don't have one. Like last night, I went to sleep and woke up at like 2 hours later, and I had one. Okay. I was just like, and I've tried everything that I can possibly get just over the counter. Yep. But nothing just seems to work anymore, and I feel it's affecting like my work.
Okay.
And I've just started an internship, and I've been off now because obviously it affects my vision and makes me feel sick. I get them like over my eyes, and they're like a throbbing sort of sensation, and they're just getting really bad and really frequent.
So how long has it been getting worse for?
Probably about the last 3-4 months.
And do you get some kind of visual change with it as well?
My vision doesn't go, but it does become quite blurred and light. It's really like, I'm literally like looking at my computer screen like dimming it down.
Okay. And will you be sick at all with it?
I have done in the past.
And how long does it tend to last for?
Good 2 days, if not 3 sometimes.
Yeah. Does anything particularly seem to trigger it?
I thought maybe Pinot Grigio would be a trigger, because every time I seemed to drink that, I would get a headache afterwards. Not that I was like drinking lots of it, like a hangover, but even just a glass. So I've cut that out completely, and I don't drink that anymore. I was watching a documentary, and apparently there was a young girl who went to the doctors about migraine, and it turned out like they were like, oh, it's fine, like blah, blah, blah. And it turned out that she had a tumour and she actually died from it.
When I talked through Abby's symptoms with her, the nature of the headaches that she was getting didn't sound anything like a cancer-related headache. The symptoms were completely different and really did just fit with a migraine. Statistics show that everybody has about a 1 in 2 chance of developing a form of cancer at some point in their life. And for that reason, there's huge amounts of attention brought to that in the media. People will have read stuff and be more aware of stuff, which is a good thing, but actually may not always have the right diagnosis. So what I want to do is have a little look at the back of your eyes. I'm just going to turn the light out.
Yeah.
Okay, sorry, it's not very nice. Fine, that all looks nice and normal. So what I would like to do is try you with something slightly different. What I would suggest is I'm going to give you a medication that as soon as you get that feeling that it's coming on, that you take one then. And what I'd like you to do is keep a headache diary for me. So to make a little track of when you're getting them, out of 10, how bad it is compared with normal.
Thank you so much for your help.
No problem. Let's hope it helps.
Yeah, thank you so much.
Okay. All right, have a good day. Bye.
So come in tomorrow at 12 and then I'll help you with your registration, okay?
Hello.
Dr. Shah, hello.
How are you?
Well, about 5 weeks ago, I was staying with my daughter down in Somerset, I got sunburned on my forehead. Well, it's now spread all over my face and my arms. The skin.
Quite dramatic, isn't it?
Yes.
Much, much worse than that. You must take off your jacket. I'm going to fill you in as to what occurred. So 5 weeks ago it started?
That was the start of it, yes.
But this terrible pain that he's had on the shoulder. Now you'll have to just look at this bruising. Oh, wow.
So tell me what happened.
Well, I was on a mountain bike and I fell sideways, put my hand out, and I still can't really bend it.
I slipped backwards as I was getting in the shower, elbows down, and smashed the decorative tiles.
Just bend it this way?
I don't think it's like broken, I think it's just like really sore, I guess, and then my head hurts a little bit.
And it wasn't that anything felt like it popped out or popped
No,
back in
no
again?
popping.
No.
It was definitely a rip of some description.
Okay.
Hello, good afternoon. And come in, take a seat. And Miss Rita, what's brought you in today?
My arm, which I got a cricket ball on the 12th of July.
Okay.
So we only started up here, and then on Saturday it was down to there, and today it's gone from there to there.
Okay.
So I'm starting to get worried, thinking, what is it? What have I done?
You're using the arm fine then?
Yeah, I'm using it. Like,
And you managed to ride your scooter here?
Left-handed on the scooter.
Using the right arm at all on that, or?
Sometimes it was, sometimes it wasn't, because it's pain in there.
There's pain in that, in and
Yeah.
around this area here.
Yeah.
And if we just have a look at the elbow, it goes straight. That's good.
That up to there, it's hurting.
It's hurting in here.
Yeah.
Yeah. And the cricket ball hit you straight on here, did it?
I don't know where it hit me. All I know, I caught it, and that was the main thing.
Yeah. So you've got the catch.
Yeah.
Okay, fantastic. Is this causing any problems around here? No. Around the elbow? No. Okay. So I'm happy with everything bone-wise in here. What happens is when you've been struck by this ball around the muscle here, there's been a load of bleeding in and around the muscle.
Yeah.
Some of that blood's quite deep in the tissue.
Yeah.
And blood, even when we're getting a bruise, it's still fluid in the skin. It's still liquid.
Yeah.
And so what's happening, every night you go to sleep, that blood's, moving backwards in the skin and just coming out. And then you stand up all day, and then the blood slowly comes down in this direction. And so essentially the bruise, which was all in here, has just ended up around here. And the fact that you're using the arm fine, I wouldn't do anything else. And it will settle down over the next couple of weeks. But nothing else we need to do at the moment.
Okay.
You okay?
As I said, that's what I was main concern, just to get it checked
What's
out.
it getting up to?
Yeah.
Exactly. Well, you can be relaxed.
Cheers.
Okay, take care, have a good evening.
I mean, that's the most terrible bruising I've ever seen. And no other reason?
No. I don't remember.
Falling,
I mean,
no
I
injury, no
occasionally
knocking.
bang myself and don't notice, but I'm used to the fact that I bruise very easily.
Yes. A blood vessel must have been injured at some point somewhere. And that obviously normally happens from knocking it.
Right. Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising that if I just bang against
No, but it's never been like that before.
No, it hasn't.
It would have to be quite a big knock. So Yeah, if you it's would have not noticed that, then it could have been one of your superficial veins here might have by itself just popped.
Right.
And then just in your case, it's just made a much bigger bleed come up here. So I think that's probably the more likely thing, because you would have felt the pain of knocking it to cause this.
But that's the shoulder. But this is, at the moment, the worst thing is...
The redness. Yeah, that skin is just irritated so badly. Don't know what
Yes.
you know. Is that psoriasis? No, it's not. This is the sun. This is a overreaction. Really? It's a photosensitivity reaction. Really? Are you sure? It can be because of different things. So it can be because the skin is made sensitive by something else.
Well, I do have a very sensitive skin, I know that.
So it's definitely not psoriasis? No. Psoriasis comes in patches. The thing we want to turn this reaction off is a steroid cream. And in your case, we might need 2. One for the arms.
Yes.
Anything below your neck is going to be a stronger one, and on your scalp and your face will be a milder one.
Right.
And what about the swelling on his hands?
This is linked in with this sun reaction rash.
I'm absolutely
It can be
amazed
dramatic.
at that.
It can be dramatic.
So really, he must never, ever go in the sun.
Ever again.
What you must do is, if you go in the sun, you must wear factor 50 on the areas that are exposed to
So
the sun.
no more trips to
and a hat.
Ibiza.
No more trips to Ibiza.
Thank you for being so thorough.
No problem.
Anyway, lovely to see you, Dr. Sharp.
Thank you very much indeed.
Bye-bye. See you.
My belly's just bloating. I should stop eating wheat. Now I'm gonna bring in my what's that tea?
Green tea.
Yeah.
I don't really know what's wrong with me, but essentially, I live quite a healthy lifestyle. Like, go to the gym like 4 times a week, eat really healthily. Like, I don't eat any overly like refined carbohydrates or anything like that. Super healthy. However, in the past month, recently, every single time I eat, it literally looks a little bit like I'm 3 months pregnant. Okay. Every single time, even if I'm only having like a bowl of soup, just blows straight up and it feels really tender.
Okay.
And it's getting to the point it's just so uncomfortable. And at night, like I literally cannot sleep because it hurts so much.
Yeah. And do you get any kind of tummy cramps at all?
Yes. So, okay, accidentally had pasta last week. And literally I was sat there at work and I just couldn't do anything. You know when you're just all cramped up? It just really, really hurt.
And what about your bowels? Regular?
Yeah.
Not hard, not too
No,
soft?
like clockwork.
Okay. Is your weight stable? Or are you losing weight?
So I
without
think my
trying?
weight's stable, but when I saw my parents last weekend, my mum kept telling me how fat I looked. But I don't know if that was only because I was so bloated.
Oh, okay. Does anything run in the family at all? Any bowel problems, celiac disease?
So my mum's got IBS.
Okay.
This is my biggest concern because I feel like it's being passed down now. Apart from that, no. My grandma's diabetic and I think that's it.
Okay, fine. Can I just examine your tummy? You have a lie down on there. Are you okay just to lift that up?
So that's where it hurts there.
Saw there.
Yeah.
Okay. And here.
No, not so much there. It's more at the sides there.
Fine. A little bit tender here, isn't it?
Yeah.
I'll let you come down. Would you eat some sort of wheat every day? So some sort of bread, pasta, biscuits?
No, it's not too much wheat, but that's only because I've consciously cut it out in the past month.
I don't think there's anything serious going on.
Good.
So that's good.
I started having a panic attack and thought, oh my God, maybe I've got like ovarian cancer. Oh, because it really hurt.
I think your symptoms, a little bit like irritable bowel, what you're
Yeah.
describing. Often people with irritable bowel tend to have some sort of bowel upset, so
Yeah.
either diarrhea or constipation. You don't tend to have that.
No, no.
So it's more kind of just the bloating and
Yeah.
things. So we'd always just suggest some blood tests, and that's really, we're doing those blood tests to make sure that you don't have anything more sinister going on.
Okay, then, yeah.
Okay. The other thing is that we're finding that certain foods are particularly bad for bloating.
As I
and
said,
sometimes
so-
it's very healthy food.
Yeah.
So people come and say, I eat a healthy lifestyle.
Yeah, that's
but it's,
exactly what I was confused.
You know,
So
things that can cause bloating are apples and pears and artichokes and beetroot.
absolutely loads of those.
I'm not quite sure why there seems to be an increase in people complaining of food intolerances. For some patients, avoiding certain foods can improve bloating. Limiting fruit juice to 1 glass per day. Also avoiding some foods that produce gas, such as Brussels sprouts, broccoli, sweeteners, cabbage. Some people find that lactose, which is mainly found in dairy products, can also cause bloating.
That's perfect.
Wait,
Thank
I
you so
think.
much. Really appreciate it. I just hope it gets better.
Yeah, it should do. It does
Keep
tend
looking
to
like
be
5 months pregnant everywhere I go because I'm so little as well. It just looks absolutely
yeah.
ridiculous.
Okay.
That's great. Thank you
All
so
right.
much.
Pleasure.
Thank you.
Okay.
Hello, could you please give the surgery a call regarding your appointment this evening and speak to reception?
I don't speak to
I'm fine. What can
Shouldn't be
I do?
asking that, should I? You should be asking me.
What can I do for you?
I'm actually need a favour. I've recently swapped into a ground floor flat.
Yeah.
And you know I've been suffering from depression and the noise upstairs is horrendous. So I've been trying to get housing to move me to a different property because they've got creaking floorboards. I don't sleep. I'm lucky if I'm getting like 2 or 3 hours of sleep a night and I'm jumping up in the middle of the night with the noise because they're dropping stuff on the floor. Housing said the only way that I could possibly get a move quicker is if I get a medical note.
And have you tried earplugs?
Yes.
And they don't help?
No.
Why not?
I feel a bit vulnerable having those in, and I don't see why I should walk around my house with earplugs on all the time.
Okay, fair enough. There are GPs who really find this is very frustrating because people are coming in, they've been pushed to see their GP for a letter that's not primarily a medical issue, and it's just a way of whoever it is who told them to go and see the GP to get them out of the room.
I mean, the noise is absolutely horrendous. They've got no carpet, and the floorboard, it's a very old house. It's constantly creaking, and the people that live there are on shift work.
It actually saved me time to do it there and then, and I did have the time because I wasn't running late. It was quite appropriate for her because she has had problems with depression and anxiety, and it was obvious this was really upsetting her and that she needed the backup of a letter, and she'd be really distressed if she didn't get it.
It's making me anxious. I'm a nervous wreck because every time things drop on the floor, I'm jumping up in the middle of the night. I just can't stay there. And, a lot of times I've been staying at friends' houses because I can't stand it.
So are you saying actually, apart from anything else, you're worried you wouldn't want to use earplugs because you wouldn't...
Well, I feel vulnerable. The house has been broken into before.
Right, okay. It's night time, really.
It's actually between 12 o'clock and 5 in the morning. And I'm a carer now for a friend who's got Alzheimer's, so it's quite difficult for me. I'm also considering going to the MP as well to see if they can move me a bit quicker.
If you want to speed up the process, I'd go to your local counsellor. I think that probably they are more likely to be helpful with housing.
Yeah, that's brilliant. Oh, thank you so much.
Okay.
Thank you. Hopefully it will resolve everything and I'll feel a lot better. Thank you for your help.
Okay, bye.
So my next appointment with the doctor is Friday. Do you feel able to wait till then?
OK, so I've booked you in 4:30 with Dr. Laird.
Right then. We had spoken last time about these stomach pains that you've had for years and years.
Yeah.
Your mum used to drink lots of Gaviscon.
Yeah.
You used lots of Gaviscon. You, at one point, had a peptic ulcer.
Yeah.
You said that on the tablets I gave you, the stomach pains got better, but you still get them.
Yeah. Now, it's whether it's to do with the tablets, I don't know. It's whether I might have eaten something or eaten too much and the pain don't initially come around and then all of a sudden it appears. It could be that, I don't know. But sometimes they're excruciating, if that's the word.
Where in your tummy do you feel it?
But round this way.
In the middle?
Mostly, yeah, mostly. But sometimes it's been to the sides. It just depends. I don't know. They just come and go. I can eat a horse and feel all right. I can eat half an horse.
Do you get any other stomach symptoms? Burping, bloating, reflux, swallowing problems?
I have trouble sort of yawning sometimes because as I try to yawn, it's lifting this pain up a bit further.
Yeah.
Then I've got to wait for a gap. I wait for an opening to yawn. I think, right, now there's a gap here. I will go through it. So, then I'm sort of like...
Having a good yawn?
I'm having a very good yawn. I'm making up for like the last 4 in one go.
Okay.
With the last 4 average yawns. I've had 5 yawns in one. That's the way of putting it.
I think you've explained that very clearly, which is good.
I'm not a big meat eater. If I was left to my own devices, I would tend to eat a lot of beanie type things.
Okay.
I tried a very tentative with egg.
Yeah.
And she had
a rash, but mainly around her mouth, and she also would vomit.
I don't eat any butter at all, apart from on toast, which is about once a week. I do eat cheese, but not tons of it. I stopped eating bacon because of this.
Do you like your milk more than your food at the moment, young man? Is that the problem?
So you thought you had put on weight, so you stopped eating potatoes.
Yeah, and just stopped eating a lot of potatoes and starch was not the thing to do. You know?
Oh, right, OK.
But I possibly went too far down that road.
And we'd spoken before about the fact that your diet was quite restricted.
Well, yeah, I very seldom eat cooked foods. You know,
it's mostly
or even
cereal.
Microwave. Yeah, it's mostly cereal. Although, just recently I bought a couple of ready meals and I buy some what they call not chicken nuggets. I eat like say 30 of them in one go.
That's quite a lot.
Yeah, but they're only like that. It's like eating I don't know, like I mean if it was like 30 gobstoppers.
When you've eaten 30 of these things, when you eat 30 of these chicken nugget things, does that give you this stomach pain?
No.
Okay. Thinking about all these things, you've never had any bleeding, you've not got any swallowing problems, and your weight has been extremely stable. So that's good.
Yeah. You know, so I don't eat a lot. Oh, I drink now and again. I do eat the beer quite a bit, but...
What's quite a bit? Because whenever I've asked you about alcohol in the past, you've said that it's very unpredictable. So if you've got some money, you might buy some cans and then
yeah,
drink.
the cans are ongoing, right? But the thing is, going out for a session is basically once every week.
How many beers will you have on the day that you get paid?
Oh, Christ. I don't know how many I've had. I don't count them.
So you might have 10 pints that day,
no,
15 pints?
I'd go more than 10, but I wouldn't say... I couldn't give you an exact figure after 10.
Does that make your stomach pain really bad?
No.
Okay.
I don't think it does anyway. I've never actually occurred, like, it's never occurred to me that could be it, but might well be.
Let's draw this to a close. I guess the question that's been going through my mind is, do we need to send you back to the stomach doctors, given that you've got ongoing, sometimes very severe stomach pain that hasn't gone away with the tablets I've given you, and we don't know what the cause is?
Right.
What's your feeling about that?
I don't mind.
I think you need one more blood count, because your last one was ever so slightly low, and it changes the decision if it looks like your blood count is dropping.
Right.
So have your bloods done. Right. Come and see me in 3 weeks' time.
I should have the blood test in 3 weeks' time.
Good to see you.
Yeah, and you.
Take it easy.
Yeah. Right, we'll find your way out again.
Yes. Left at the end.
The lungs seem to be working, don't they?
Hiya, I've just lost Lily. I think she might have gone to the toilet.
Oh, okay.
So she said, fine. I haven't looked because she's just been taking her weight and all preparing stuff.
Hi, Mike. My name's Sean.
I thought I've lost you forever.
Oh, Brenda.
I broke my leg. No, that's
all right.
People. Okay, Lily, sit down nice and quietly. School and nurse noticed the differences in Lily.
Okay.
And they sent me to see you about her nosebleeds.
Right.
They're very violent and very often.
Oh, honey, just be careful there, because I don't want you to go too high and then fall off, okay? Let's bring you back down a little bit.
She's a very active little girl.
Okay, and nosebleeds, how often does she get those?
She had one yesterday. It wasn't that bad. How often? It's not regular, but...
Like once a week, or...?
It would be like a couple of times a week, and then it will stop for a week or two.
Yeah.
There was a month break, but when they come in a serious. Like, there's more of them.
Can I have a little look in your nose? Is that okay?
Yeah.
Yeah? So, what's the longest without a nosebleed? A few weeks?
A month,
maybe?
It was, I think, a month.
And when she's having a run, how often does she get them? Every day, or...?
It will be every day and a couple of times a day.
And what do you do when she gets a nosebleed?
What we do is I've researched to hold the tip of the nose.
Absolutely, yeah, that's right.
Do not lie her down.
How long does it take to stop bleeding?
10 minutes, that's the minimum. They're very violent. There's lots of blood coming, sudden, like boom, and a big rush.
There is a peak in the incidence of nosebleeds from the ages of 2 to 10, and then in the older age range of 50 to 80. Just relax your nose. Don't scrunch it. Relax.
Is it going to hurt?
No, it's not going to hurt. I wasn't 100% sure on what was causing Lily's nosebleeds. It might be because there is prominent vessels in that part of the nose. Also, there was some crusting to the nose, and certainly an infection can cause nosebleeds, and it's always worthwhile treating. What we're going to do is I'm going to give your mum some special cream that I want you to put on the inside of her nose, OK? 4 times a day for 10 days.
10 days?
Hopefully that will stop the nosebleeds.
Be sad. 94649.
Wow. We're happy. All right, there we go.
Lila,
okay.
you've got to stop. You've got to stop now.
All right.
Thank you very much.
Bye-bye.
If you feel he needs to be seen, I can ask the on-call doctor to call you.
No, you're full of stress.
Wouldn't you be stressed? Can you put yourself in my situation?
I know.
Instead of ganging up on me?
We don't gang up on you.
You did.
We just want to help you.
Even
Take
Chelsea brought
Take the stress off.
Come in.
Pleased to meet you, mate.
Hello. Please do all have a seat.
I'm from Australia.
Are you?
I'm over for about 3 months.
Great.
Recently retired from work.
Oh, congratulations.
Well, I've done my bit.
Yeah. What job did you do?
I work for council in Sydney.
In Australia?
In Sydney.
But you're from the UK originally?
Sheffield.
Sheffield.
Yeah, you can't take his way, can you?
You can't. What can we do for you today?
What happened is me looking after myself since I've retired. Go to the gym 3 times a week.
Yeah.
Swim, do my 30 laps after half an hour in the gym.
Well done.
Yeah, exactly. I'm feeling good, lost a bit of weight, looking after myself.
Brilliant.
Started getting floaters and flashes.
Oh dear.
Exactly. So straight away I went to Sydney Eye Hospital.
Well done.
There's no detachment, but he says it's important that you have a follow-up in 6 to 8 weeks.
So we've got to try and arrange a way for you to see an eye doctor.
That's right.
To have another examination.
That's right.
There we are. Well, we can sort that
in around
out.
about 6 weeks.
I can sort that out for you.
I've not slept for 2 days, so I think that can probably affect this. I don't know, can they cure floaters?
No.
Kind of thing now, instead of turning my head suddenly, I might get a little arc, light flash. But I've got a floater there now, but I'm kind of learning how to put up with this.
Yes.
Floaters are shadows which are cast on the retina by debris which is inside the eyeball. The retina is the thin lining at the back of the eye which detects light. That's what you use to see. In most cases, floaters themselves don't need specific treatment.
What I'd like you to do is, on the way out, if you hand this to reception so they can photocopy it.
That's fine.
And I'll send this off with the referral.
Yeah.
If we're not able to get that organised routinely, we can get you seen in the emergency eye clinic.
Oh, that's fantastic. Oh, that's good.
So that's easy to sort out.
Thank you for your service.
Nice to see you.
Much appreciated, and thank you very much.
I don't know what's causing it, but essentially my mouth is very sweet.
Very sweet.
Yeah, it tastes like I've always got sugar in my mouth.
I have to say it's a completely new one for me. I've never heard anyone say that before.
I couldn't feel anything here and here, like when I had anaesthetic.
Do you have swelling on your tongue as well, or just the mouth?
Not the tongue, just the
And your
mouth.
breathing was okay?
Well, okay.
Okay.
Every night this week, nothing, except for last night.
All right.
It started again last night. I thought, well, what's going on there?
Feels like something's going to pop out of my ear.
Okay, nice.
your tea. You're not drinking your tea.
Coffee it is.
Yes, coffee. I drink tea just like that.
Black.
Yes.
Right then.
I never had this before.
Right.
I went to bed Monday night.
Yes.
And when I wake up to spend a penny, my whole body was in pain. All my back just hurting. I was in a terrible state.
Oh gosh.
What do you think caused that?
Not sure. I need to ask you more about it, then we'll decide. So, do you have a headache?
Yesterday, I was having like a headache.
Right.
I don't have it today.
Where does it hurt today? Both knees?
Both knees. And
elbows?
Elbow. And when I do like that, when you do like that, I wanna.
What do you mean?
But when I breathe in, you could feel a pain around here and all that.
Right. Is your vision normal?
Yes, vision. You know, sometimes I get the vision. Sometimes, like, the light, not this kind of light, like the bulb.
Yeah.
The bulb, like a zigzag, but it,
A halo?
What is it? No, halo is round.
Oh.
This is not a round. It's like a zigzag.
Okay. So can I have a look at your shoulders, maybe?
Yeah.
Can you maybe slip this
take
off?
this off.
Have you got a T-shirt on?
No, I don't really, I can't wear up clothes.
Okay.
Yeah.
So let's just check up here. Are you tender around here?
No, it's all right when you touch it.
That feels all right?
Yeah.
Fine. Let's just work around your shoulder joint, okay? Okay.
Yeah, yes, when you press.
At the back?
Right there, sir. Right
Okay. Can you stand up for me? Okay.
there. Yeah.
Perhaps if you have a seat.
On the bed,
Yeah, just sit on the
Yeah.
edge for me.
like somebody was bashing me. Oh,
All right. Can you put both hands behind your head for me?
yeah.
Can you push your elbows back? Does that hurt?
A little, not much, a little.
Can you put your hands behind your back as though you're doing your bra?
I can't do my bra that way. I have to do it in the front and then turn it. Yeah.
So can you show me your knees? So which knee's worse?
This one.
And where does it hurt?
This, you see how this one's there?
Let me just work around your knee. Does it hurt on this
And your
side?
hand cool.
They are cold, aren't they?
Yeah. Oh, it's so cool. Feel my arm.
Oh yeah, your hands are much warmer.
Yeah. Yeah, you see.
Oh, you've got a little...
What? A cyst?
Yeah, a little bit. Can you bend your knee for me up and down?
I exercise it. I try and exercise it every day.
All right.
Why I wake up with this pain?
I'm Paul, the healthcare assistant here. Come for your blood test.
Oh my God.
Is this your natural hair or is this artificial hair?
Yeah, natural hair.
Sorry, it squirted. It's definitely a cyst from the fact that it's squirting everywhere.
I've done blood tests quite a few times. It's quite difficult to
Really?
find out, yeah.
I like a challenge. Yeah, got it.
You can have the record for the most wax down your ear. Oh my God. Yeah.
Come through. All right, I'm Karen.
Thank you. How are you?
Sit here for me.
Yeah,
Lovely.
exactly.
Okay, so you come to see me today about smoking, is that right?
Yeah.
You want to give up, do you?
Well, I'd like to. I'm 75. I've been smoking, just to fill you in, since 1954.
Right.
So it's going to be a long, hard job. I've cut it down to 4 a day.
So why all of a sudden you decide you're going to stop smoking?
Well, because I've had a bit of trouble in as much that I've started falling over.
Okay.
And I think that it's down to...
So you've never given up smoking before then?
No, no.
You ever tried the inhalator and the the electronic cigarettes? No.
Well, the flavour is disgusting. It's not tobacco, that's for sure.
Well, no, it's not. That's the idea of it. You're addicted to the nicotine, but the thing that's killing you is the tobacco itself. So there's obviously things I can give you to help you to stop smoking, like patches. And obviously there's oral products as well you can use, chewing gum, lozenge.
That interests me, chewing gum.
Chewing gum, because you can't get rid of the last 4 cigarettes, I think you probably may need a small patch.
Well, probably, yeah. Probably.
You're going to give it a go?
Oh, certainly.
Okay, I'm just going to go get my machine to take a carbon monoxide reading. 1 minute.
Okay, yeah.
Paul, have you got your machine?
Yeah.
Could you do it for me?
Yeah.
Thank you, sorry. I've got my colleague with me because his machine's working
Hi.
and mine's not.
How are you?
Okay.
So
Yeah,
this
fine.
is Mr. Durnsford.
So in a second, I'm going to get you to take a deep breath, like that, and hold it in. And then on the 3rd beep, you blow out through the tube slowly. Just release it like that. Okay, take a deep breath. Hold it in. Hold it. Hold it, hold it, hold it. And the 3rd beep. So now blow out slowly. Until you can't blow anymore. If you
That's
stop,
it.
that's fine.
Lovely, thank you. All right, that machine's telling us that your oxygen loss level is 2.4%. So that means your vital organs, liver, lungs, kidney, especially your heart, is working 2.5 times harder to keep you alive.
Oh, God.
It should be naught.
Should be.
Yeah, it should be naught. Yeah? So the plan of action will be, I'm going to give you some low-dose patches. The patches are used 1 a day, and I'm also going to give you some chewing gum. You can have that as and when you need it.
That gum,
Yeah?
will it increase my CO2 emission?
No, it's going to release it. Because if you stop smoking, that's what the idea of this is about.
Oh, right, right.
If you'd like to come to the waiting room, I'll bring you the prescriptions to you. Come on, then.
Come and have a seat over here again.
What's your name?
Dr. Pierce.
Pierce.
Yeah.
Pierce. Oh, I used to work with a lady named Mrs. Pierce.
We have met before. I think you had a chest problem then.
Oh, when I have that, oh, God, sorry. Jesus.
Right. I'm not absolutely sure why you feel like this. I think that there are some things that we should rule out.
What, like what?
I want to rule out a problem called polymyalgia.
What is that?
It's a muscle inflammation problem.
Because somebody was saying to me I could be having inflammation.
Polymyalgia is a syndrome causing muscular pain and stiffness, which quite often comes on relatively suddenly and usually affects muscles in the upper body, around the shoulders. It can make people feel quite ill and tired. It more commonly affects women and only really affects people over the age of 50.
So I think the way to do that is with a blood test today. Yeah. Maybe we should see you again tomorrow with the results.
Tomorrow, Friday. So I have to come or kind of phone or so.
We could phone. I'll leave it on the list for somebody to look at the results tomorrow and ring you.
What time? Oh, they would ring me.
I'll ask them to ring you and tell you whether or not you need to start some steroid tablets.
Oh, God.
Whenever we talk about polymyalgia, we also give people the same advice. If you were to suddenly develop a very severe headache or have any funny changes in your vision, you need to tell us immediately.
Okay.
I don't think that'll happen, but we always say the same thing.
Yes. Well, it's nice of you to give me all these instructions. Doctor, you married?
I am married, yes.
You have children?
I do, yes.
How many?
I've only got one.
Only one? Oh, how old is she?
8 months.
Oh, it's a baby. A girl.
A girl.
What's her name?
Isabel.
Isabel. Oh, dear.
So, take these round to room 1.
Yeah, room 1. Hold this for me, please. I can get them. So when you get old, you know, all kind of things. You want to get old?
Not really.
Anyway, I'll see you and thank you.
All right.
Yeah. Bye.
Bye-bye.
Thank you. Thank you very much.
Pleasure. I hope you feel better soon.
Okay, thank you.
Okay, wonderful stuff. Take care. Thank you.
Nice to see you. Bye-bye.
Bye-bye.
Would you say thank you to the doctor?
You're welcome. Are you going to let your mum put the cream on so it gets better? You're welcome.
Brilliant.
Right.
Thank you very much for that.
Okay, nice to see you.
Nice to see you.
Bye-bye.
Thank you.
Bye, thank you.